Will the clerk please do the roll call?
President Norris.
Here.
Vice President Young. Here. Secretary Spikers.
Here.
Commissioner Herron.
Here.
Commissioner Pollard.
Here.
Are there any changes to the agenda?
I just would like to make one comment, and that is, when we get down to the discussion about the CEO replacement, I sure would like us to break into executive session for a few minutes, because some of the things that deserve to be said and might be said involve other employees and so forth, which should not be discussed in an open session. So just if the other commissioners are interested, I'd like to see us go into executive session for a few minutes under old business.
Is there discussion about that change? Do other commissioners feel like they would, that would be a change, so we would need a, okay, is there any objection to that?
I just wondered when this would take place, because interrupting the meeting.
That's a good question.
Whole business, is that appropriate?
Did you have an idea, Commissioner Pollard?
I think it could be a rather short meeting. We'd announce.
That's not what she asked. She would like to know when during the meeting you'd like to have.
Oh, I would say, Madam Chair, at any point you see as most convenient, but perhaps at the old business, somehow prior to the actual presentation of the resolutions and so forth.
How long would you like this meeting? Do you estimate that you think this meeting
I
should be?
think about 20 minutes should be fine.
How did the other commissioners feel? Do any of you have a comment or a thought about this?
I don't have any problem with that. We can limit to maybe 15, 20 minutes. That's, I don't have any problem. So if you want to make that motion, I'll second.
I so move. That is that at the point of the old business, the commissioners will break for executive session for approximately 20 minutes.
And I second that.
It's a legitimate change. I guess that's okay. All those in favor of the amended agenda, say aye.
Aye.
Those that oppose, then the ayes carry it, and we will make that change.
And I have another motion for the agenda. In Finance Committee, we talked about benchmarking and putting that on the agenda. We're really trying to push to get this started. I had to call for the contract today, and I haven't had a chance to look at it. And I think it'd be prudent to have our legal staff, because there were some questions I don't think that legal staff could answer because they haven't reviewed the contract, and I certainly haven't. I'd like to put it before the board for discussion and then for vote at a later time. So whatever, if we need a special meeting or if we can do it at the next agenda, that's fine, but I would like to amend the agenda to include new business, discussion of benchmarking, and proposal by TrueBand. I think that's, I don't know if that's really in the agenda or not. I know it's attached.
Point of order, Madam Chair.
State your point.
A part of personal inquiry. Now, this is in the Finance Committee's report about benchmarking.
Yes.
But I take it what you're trying to do is to get it announced tonight so action can be taken by next month. Is that the point?
Correct, or sooner.
Or sooner. Do we have a deadline?
Well, we don't, actually was able to extend the deadline today with Dana. She's very helpful and said she would keep that same price for us if we did intend to go with that offer and contract with them. And I don't know why the contract wasn't provided. They said they had asked for it a week ago, but she said they never, and I had to make it a priority. So then it was sent to us today.
Further point of clarification, Madam Chair. So you say or sooner. Will that hold until our next meeting?
Oh, yes. Yeah, the price will hold the next meeting. I just didn't know how fast people and importance that we want to get this benchmarking system started.
Okay, so do we have a motion then to put that on the agenda as an
Second.
item?
I second.
And, or do you want it in finance committee as an item?
I just put it on new business so that we put it before the
Okay.
whole board,
Okay.
so that we can properly discuss it and have it, something on for potential voting next board meeting.
Is there any objection? Then we will add it to the minutes, or to the agenda, I'm sorry, as item 5. And there will be a discussion on the benchmarking. Okay, next on our business is to approve the minutes. Well, are we accepting the agenda as, somebody gonna make a motion to accept the agenda as amended?
I'll make that motion to accept as amended.
Second.
All those in favor say aye. Aye. Any opposed? Okay, the ayes have it. We'll move on. Next thing on the agenda will be approval of the minutes from May 5th. Are there any corrections to these minutes
For additions.
or additions? Yes, Commissioner Pollard.
With respect to who is present, a couple of items. One is, let's be sure to list the commissioners in alphabetical order, which would mean that Mrs. Heron would be above me in the listing. Minor issue. Okay, and I think that we should add the names of other members of the staff who are present at the meeting. That's generally done in cities I've been to. For example, Steve Daniel was here, Chief Finance Officer. Kim Whitcomb, I believe, was here last month, and her title. And then in addition, Bob Jeans is a special envoy from the city of Snoqualmie to the hospital district. And I personally would like to have him listed in that capacity.
Is there any,
I have other comments, but let's see other people may have.
is there any objection to those changes?
I don't have any objections. I think it's trivial about alphabetical order, but,
I said it was good.
I think it's listed in terms of like the president, vice president, secretary probably, and it makes no difference to me. I could be last, I don't care.
Well, I see that it's listed with the officers and then 2. We all have commissioner numbers.
That's a good point, Madam Chair.
Yes.
My comment was only about those that don't have titles, that are just commissioners. And I was just suggesting that for those two, that is Mrs. Heron and myself, that we be listed alphabetically, since we have no title. But I wouldn't disturb the other listings for the officers.
Nice. I'm okay, even if it's fine, I have no qualms about it. They can remain the same.
Is there any objection? Hearing no objection, then I think we'll go ahead and do that.
Were you calling for additional corrections? In the
Do you have an addition?
Yeah, and the other person that might be mentioned, Jim Simon is a public member on the Finance Committee, and when he comes, I figure he's in some kind of quasi-official capacity. I'd like to have it noted when Jim Simon is here as a public member of the Finance Committee.
Well, he's on the minutes for the finance committee, but
When we're listing.
if you want to be listed twice,
No.
I think this is additional work for the clerk, and I think as long as people are listed, like Jim is listed in the Finance Committee, I think that we've already covered and that's available to anybody.
That's fine. All right, next comment, whenever you're ready.
I am ready.
It says under communications, we have removed all audio files for 2014 for reasons given here. I'm concerned that that might be in violation of the state record retention rules. Especially if we did not make CDs of the material that we deleted.
Yes, please.
We still have the files, they're just not on that web server, so we still have the files. And as soon as we have enough capacity, we can load them back in, and I'll follow up on that.
That's excellent, and I might mention that other districts sometimes have those audio files for years, going back years, so.
I think the word capacity is the key word. Are there any other edits or changes?
Let's see here, no, I think that's correct. With respect to item 3, or page 3, it says here, President Norris asked the Commissioner Powell to submit a proposal on those services. I think we agreed that would be, the issue about home health care would be on the agenda of the strategic plan, not that I was supposed to submit the plan. On page 3 at the top. President Norris.
Is there any objection to that change? Not hearing any objection, we can go ahead and have that change made.
It would be changed to read, this will be taken up at the strategic planning session.
I think what is missing is just a proposal for the strategic planning session. That's what I think she meant. So she did ask that question. I do.
And what, I'm not clear. Clarification.
She asked you to submit a proposal to our strategic planning person to put that on for strategic planning.
Okay, I will. I don't know whether I will submit a plan for it, but I definitely raise the issue.
An idea or something.
Yeah.
I think that's what she.
Okay, it's unclear. So thank you for the clarification.
Okay. Is there any other?
With respect to item on page 5, item 3, Commissioner Herron renewed her request to hold monthly work study sessions. I'm just curious, is there anything more to report on that?
Do you want to address it or do you want me to?
I will address that during my report.
Okay, thank you, Madam President, that's all I have.
Thank you, Commissioner Pollard. Is there any other objections or changes to the minutes for May 5th? Not hearing any, we will move on in the agenda. Communications. I had one, but I don't know, and it was for a class, so I'm am talking to Tom, our superintendent, about whether that's appropriate for any of us or what would. I got an email just today about a class, so I don't know.
About what?
A class for commissioners, and I don't know if it's appropriate for us or not for public health. Just to let you know. Okay.
So if we're interested in a class on public health, we should let you know, is that it?
Well, I just got the email today. I don't know anything about it, so if I get further information, I will let everybody know, and then we can have a discussion.
Right.
Right. Okay. Okay, as a reminder, our meetings are conducted under Robert's Rules of Order, so there are 2 guidelines I want us all to be aware of. No one may speak a second time until everyone who wishes to speak has done so. Each commissioner has the right to speak twice on each topic under the discussion. We will be following these rules during our meeting tonight, at least trying to, and I'd like to thank you for keeping them in mind as we move forward.
Point of clarification.
Yes.
Robert's Rules, and perhaps this should be addressed to the parliamentarian. Robert's Rules does provide special rules for small boards, 12 and under, that are a bit more relaxed. And I wonder, if we consider the possibility of using the rules for boards under 12.
May I address that?
Yes, you may.
So it's my understanding that those possibilities are there, and the board should, if it chooses to do so, adopt them in a formal way, which this body has not done. And the specific citation says, Robert says, unless a rule has been adopted to the contrary. Commissioners, every member will speak twice.
Clarification, Mr. Pollard.
Yes. Robert's Rules, I think one of the advantages of the more relaxed rules, Robert's Rules in the formal section limits a speaker to 10 minutes. That should be adequate for anything. But I think that under the relaxed rules for boards of 12 or less, there's no limit, it's just, use common sense sort of thing. So there are some things we might want to look at the special rules for boards under 12 that might be to our advantage and help us move our meetings along smoothly.
If you would like to do that, I would suggest that you bring that to the board as a, would you like to confer with the parliamentarian?
I think the parliamentarian knows exactly what I'm talking about, and what I'd like is if she would, to just make some analysis. She's been to our meetings now many times, she knows our dynamics, and perhaps she could consider making a recommendation to the board about where the rules might or might not be relaxed in accordance with the small board provisions.
I'd be happy to do that. Thank you.
Thank you.
Commissioner Palmer. All right, we will now be hearing from our interim CEO, Tom Hunt.
Thank you. Last month, I talked about the dashboard that we have been bringing to the commissioners on a quarterly basis, and then it would eventually be going away. As already been mentioned tonight, the Finance Committee has been working on a benchmarking project, and that is to select a benchmarking tool that will be helpful in providing comparator data for the district's operations. And I won't say anything more than that. Commissioner Spikers will be reporting on that during the Finance Committee report. But I will just say we are looking forward to having a tool that will help us to be able to do a number of things. But with respect to timing of the project, Steve, Daniel, and I are most anxious and hopeful to have the benchmarking tool in place to assist us as we go into the budgeting for the fall season. The ramp-up time for the benchmarking tool that we're looking at is about 2 months to do the analysis and to roll it out throughout the organization. That said, an adoption of that tool at the July meeting would still give us the months of July and August before we start into the fall budgeting time. A couple comments on strategic planning. One is that each of you probably know that you have been scheduled for one-on-one discussions with Andrew Ballard. I'm happy to say that all of those have been set up for commissioners and the executive team. Val, thank you very much for that. I'm also happy to report that we have, as you know, our first session scheduled for July 20th, and as of 30 minutes ago, we were able to schedule our second session for August 29th. Now it's a month after, but that said, knowing everybody's schedules and Val describing the summer, the challenge of summer schedules, I'm happy that we're going to be able to finish the strategic planning work by the end of summer, and again, have that going into the budget season for the 2017 budget. Also want to let you know that I've been working with Andrew on conducting a community input survey to support the strategic planning process. It's work that Andrew has done frequently with the organizations with whom he has worked, and he has a very tried and true process for getting community input electronically through a survey that we would advertise and have as many residents of the district participate in our strategic planning process by filling out the survey and helping us to understand the services that they need. As was mentioned last couple of meetings, we've talked about board work/study sessions, and Commissioner Norris and I on Tuesday will be attending Evergreen Health work study session to see really how they conduct those sessions. I don't think that the result of that is we're not really looking about whether or not we should do those sessions, but really how they are done. We would like to have, we in the executive team have been talking about holding a work study session sometime between this meeting and our July meeting. And I would like to propose that we do that. Val's probably just crossing her eyes right now at the idea of trying to get us all together sometime between now and the July meeting. But I think it's really important for us on a couple of agenda items. One is that we had a presentation from Dr. Wickoff at the Finance Committee regarding ACOs and how it's changing the nature of how clinics operate and manage care under the Affordable Care Act. And I think it would be very helpful for all of us to engage in a work study session specific to what's happening in payment reform and how hospitals and health systems are responding with ACOs. Additionally, we have now established email addresses for each of you, and we would like to roll out a training on use of those new email addresses at the same session. So we can do a 2-for-1. I just want to take advantage of us all being together for that session. So if there's no objection, I would very much appreciate us trying our first work study session during the month of June. Couple more items. One is we've been talking about moving out of the district office. Work continues on that with an idea that came from Jay Rodney and Valerie. We're going to be able to move much faster on that. It resulted in some domino effect throughout the hospital of moving some people, but I'm happy to report that we will not have to do any interior remodeling or construction in order to make that happen, and that idea saved us about $10,000. Lastly, I'm looking forward to our being together at the Rural Hospital Leadership Conference. In lieu of having a dinner for just us, there is a dinner that I encourage you to attend. It's on Monday night, hosted by Parker Smith and Feek Insurance Broker and Hall Render, a law firm. I think you've received those emails from Valerie to register for that, and I think that's a great opportunity for us to do two things, and I think that was both of, I think we expressed two goals for that evening. One is to be able to get to know one another better, but also be able to get to know our peers at other hospitals and be able to tap into that unique opportunity that this conference provides for us. Thank you.
Thank you. Do any commissioners have any questions for Superintendent Parker at this time about anything we said?
I just wonder whether, Tom, you might want to say something about the meeting we had with Mr. Terry Fine, so that doesn't have to wait another month to mention.
Thank you very much, Commissioner Pollard. Commissioner Pollard has suggested that a few of us, that being Steve Daniel, myself, and Scott Nohavik, who is our Director of Facilities Management, meet with him at the Mount Si Golf Course and meet an individual there by the name of Terry Fine, who provides horticulture design and management for the areas right around the clubhouse with an eye toward how can we do something similar for the hospital. And I have to say it was a great experience. I saw the first impressions of our facility in a whole new light. We realized that there's a lot of things that we can do that won't cost us very much money, but will greatly add to the beauty of our facility, soften some of the first looks. And Terry actually came out to the facility and gave us his first impressions, which I couldn't argue with. And that was there are some plants that are tired looking. They're already, we have a beautiful opportunity in the roundabout to have a great first impression, and we're missing it right now. And so Terry had some great ideas. We took a lot of pictures, and so we're going to keep working with Terry. He's going to provide some design work for us, and his rate is very good, and that'll give us the roadmap that we need for some further beautification of that first impression. Thank you.
May I add just something, and that is just to clarify that this is the Mount Si Golf Course, right? And if you go there, I haven't been there for years, but if you go there, it's like a botanical garden. It is really amazing, and it's wonderful. We can learn something from Mr. Fine, who's a resident of Sammamish, and I've been in the neighborhood here for 40 years, And you can see this as a community service sort of thing, as much as anything.
Thank you, Commissioner Pollard, and thank you, Tom, for sharing. Committee reports now, actions required as noticed. Finance Committee, the next item of business is a report from Commissioner Spikers. You have the floor.
Thank you. We thoroughly discussed the accountable care organization proposal. Dr. Wickup had gone through it. I think I gave her a lot of pointed questions and cross-examined questions, as I usually do. I think that the whole board needs to really, really delve into this, because this is a decision, apparently it needs to be done within the next 30 days. And I'm concerned at the cost, and, you know, it's my understanding it's a double-edged sword, or it's a catch-21, or whatever you want to call it. If you don't do it, then you could be losing patients and all of the data that is collected, and if you do it, it's going to cost you a lot of money. And I kind of want to look at this in terms of, I understand that you're not going to get any money out of it by joining it. It's going to cost 10 or 12,000, whatever it is, $8,000 to $13,000 a month, I thought, which is pretty hefty, and it's catered toward outpatient services, and that's what we need to grow, and that's what we're stuck at right now, trying to grow our outpatient service lines. Is this the way to go? I think commissioners, again, need to look at this carefully, study it, come to the table, you know, in a work session, and be prepared to ask questions, because I don't think it's as simple as what staff thinks it is to be able to do. And they know that they have to do it, but is it going to increase their service lines and outpatient care to the point where it's going to pay for that, you know, by having that many more outpatient services and customers and patients, that it pays for itself and then some. So in a way, it's if we don't do it, we're not going to get access. We're going to lose the boat. You know, we're going to fall off the plane.
Have opportunity for more discussion about this in new business.
So anyway, I understand that, and it was in the finance committee, and so I thought I would share my thoughts with that, because it was a big part of the committee discussion. The hospital volumes were not down too much, but for the second consecutive month, we've had a lot of Medicaid payers in our inpatient, which has caused as much as 22%. And I've been on the finance committee for a long time. I distinctly remember Medicaid being between 3 and 6% of our total inpatient services and payers, I should say. And to be at that point, we will go under real quick if we continue that type of direction. And I say it like it is because I see the writing on the wall. So I think what's going to happen is there's going to be new procedures in place, which I already thought there was, with respect to guaranteeing that when we bring these patients in, they have a secondary healthcare plan. And because if we just can't do it, we can't lose. You get $175 a day for a Medicaid patient, and no matter how much we want to help them, everybody needs help, and when it comes to the hospital. But 50% of our inpatient patients are from outside of the district. And I'm concerned that type, spending, taking a hit like that, $175 versus what we get reimbursed for Medicare, which is 99% of our costs, is somewhere around $3,600 or $3,800 per patient per day, if I recall. And that's a huge, huge swing. So if you have 2 patients for 30 days, and you figure it out on a calculator, it's in the hundreds of thousands of dollars per month. And we can't do that. And this is going to be hopefully the last month that I'll see this. I will not accept 22% Medicaid. I will not accept more than 10%. I'm not going to, it's got to stop. We will go broke, definitely. And the procedures have got to change. And that's pretty easy to figure out when you get paid $175 per day versus $3,600 or $3,800. And you know what? Maybe we don't have a full bed. Then we don't have to pay. Maybe we don't have a full hospital. We don't have to pay as many staff salaries. I don't know what the answer is, but this is cutting right to the chase on this issue for this hospital. And we cannot afford to continue this way. This is the second month in a row. I thought it was going to be fixed from last month. We did lose $400,000 as a result. I think it could have been a lot worse had we not had other measures instituted. Tom's been doing some great things and cutting back some of the expenses here. He's cut some costs. We're going to save eventually $3,500 a month on everything's taken into account, but that is like uno number one in this thing. We've got to stop that. We can't. We've got to put in an immediate stop to that. We cannot do that. And I will expect that next month it'll be below 10% Medicaid because nobody can function at 22% Medicaid in the whole world, or the whole country, on an inpatient basis in a brand new hospital. So hopefully that rings a bell today. I did have that discussion with the finance group. I think everybody understands that. I don't think it was, something, I don't know what happened, but it was something that is serious in my opinion. And when you have a full hospital for most of the last year, 95% capacity, we should be doing pretty well. So it's a matter of who we get to pay and who our payers are, and that's what will make or break things. So we had, like, again, average daily census 23.7. We only have 25 beds. I mean, can't do much better than the volume. So the other things I want to talk about, I guess, are that was my main concern when I saw that. Anyway, the other notes, if you all have a copy, you should be able to have a copy of the finance minutes. I'll take any questions.
Question. I have a question. I understand that most of our patients are Medicare, Medicaid.
70%.
Yes. Yeah, that's
With the self-pay, which is no pay.
What about, how are we, or what are we doing to reach out to those private pay insurers? That would also
Well,
be added into
I
our
think
population.
Tom has revised our program. They revised things here, was about 9 months ago, wasn't it, Tom, when we revised things to capture some of the private pay?
Yeah, there were 2 steps. May I comment on that?
Yes, go ahead.
So the first one that we did was with respect to Medicaid as a primary insurer, and that was over a year ago. We had really hit our budget. We have a budget for how many Medicaid days, how many Medicare days. We quickly hit our budget on Medicaid. And so we said, we can't take primary Medicaid at this, and really that has been the way it's been since almost 2 years now. What we saw happening was patients who have Medicare exhausting their Medicare benefit and then going into Medicaid, then becoming a Medicaid patient because their secondary was Medicaid, not a commercial payer. And that was the change that we made about 8 weeks ago. The reason that you don't see an immediate effect of that is because our average length of stay is about 28 days. But we have a number of patients who are on Medicaid now who have an even longer length of stay. So until those patients discharge, we'll continue to see their Medicaid days. As you know, we've had some patients with a very long length of stay. We have been able to effect successful discharge for one of those patients, and we have 2 others who I would say there's more light at the end of their stay than that's light at the end of the tunnel, but light at the end of their stay than we've seen in a very long time. Some very encouraging progress for those patients. That's really the key right now, is to help these patients who are on Medicaid to be able to have a successful discharge. And once that happens, then the intake criteria that we put in place will start to have its effect on lowering the percentage of days that are Medicaid.
I have a question, Tom. Do we know when patients come in what kind of backup plan they have for
Absolutely.
discharge?
Yes.
But
Yes,
that doesn't-
it doesn't always turn out that way.
Okay.
Yeah, so what we said is we want to see a primary and secondary payer, neither of whom are Medicaid at this point, because we have far exceeded our budget. And this was a great question that Commissioner Spikers asked during the Finance Committee, and that is, how does this affect the relationship with discharge planners at area hospitals who refer patients to us? They all understand very clearly. And the messaging to them is that we budget for a certain number of Medicaid days. We have far exceeded it. And at this point in time, until we get under that number of Medicaid days, we can't take more Medicaid patients. And they uniformly have understood and support that, and the referrals keep coming.
One of the things I thought might be a little bit, because I know these kinds of things can flip up when there's only so many days available for Medicare payments that can be reimbursed, available, period, for any one patient. So we may get a patient with X number of days, and it's not been reported yet that they're used up all of their Medicare reimbursement days, or they have already, I should say. And we're kind of stuck with okay, we admitted them thinking, and then it pops up, they finally bill out later, 30 days later, we find out, oh, geez, they don't have any Medicare reimbursement left. So it's something we can get blindsided on that, and it does happen a lot. One thing I thought that might be helpful is to obtain the rates of that occurrence, and project that even when we take a Medicare patient, how many times does that happen on a percentage basis, so that we can prepare, we can say, oh yes, well, instead of taking the 2 Medicaid patients this month, we know that there's going to be probably another Medicaid patient on Medicare that we thought was going to be Medicare, and maybe project it. It's not the staff's fault that this has happened. That's not what I'm saying. I'm just saying we need to resolve it. And this happens because we get blindsided. We don't know if Medicare is available or not. It says, yes, they are, on a piece of paper and in the computer. But this can happen, and I think if we were to look at our percentages and maybe make a little better prediction based on past experiences, I would think that we could say, hey, we don't want to take one more Medicaid patient because we think that at least one of these Medicare patients we're going to get is going to probably not have Medicare reimbursement. So that's just a thought.
First, a question of Tom, following his comments, and that is, do we really have a choice? This is one of the states that said that we would adopt the Medicaid option. And now we're talking about human beings here. What about, these people need health care. If they're not going to get them with us, where are they going to get them? Now, what I hear Mr. Spiker say is we're going to screen them at the referral stage. That is,
The referral stage.
at the referral
And this
stage.
has nothing to do with our ER. Everybody that comes to the ER
Of course.
gets in.
But we certainly don't want people to go to the ER because they can't get into our normal hospital.
That's true.
I
That's
can,
very,
I can comment on that.
but you see what I'm getting at? I can articulate this a little better, but go ahead.
We're not alone in the number of hospitals that have very long length of stay patients. We know that there are, every hospital in the Seattle area has patients in their hospital who have been with them in excess of a year. So frankly, if they don't, they're not put on the street. They continue to receive care in the hospital that they are in, and their discharge planners keep looking for another venue. We are not the only place where someone can come for post-acute care. There are a lot of options, and they just keep working them. We've actually, it's interesting, we've received referrals from outside the Seattle area from time to time as well. Portland for patients who actually have family in the area, but they're in a hospital in Portland. And so we know that the hospitals here in Seattle do the same. They will look even outside the state for a placement.
But a patient in our hospital who's on Medicare, and I heard you say, and runs out of Medicare eligibility. By the way, isn't there a point at 21 days where things change? To keep that aside for a moment. A patient who's in our hospital runs out of Medicare eligibility and goes to Medicaid, we can't move them out at that point.
That's not the criteria. The criteria is, have they met their goals? Are they stable
Right.
medically? Are they ready to go? And are they now ready for the next venue and the next level of care? And that's when the social workers work on finding a next place for them.
So if they're not ready to move on, they've come in as Medicare, they've transitioned to Medicaid, we just keep them.
We do.
Okay.
We do.
So we don't have we don't have that much flexibility, as I understand it. And when Mr. Spikers, if I heard him correctly, say, we just can't accept that, we've got a budget amount. And all
That's
this.
on the intake side.
That's only on the intake side.
Only on the intake.
Okay.
Yeah. And once they're in our hospital, that's it. They have to go through all the procedures and criteria to be transitioned anywhere else. So it's a dilemma that I do recall was 5 to 6% Medicaid for years that we had any time period, and that has gradually grown. It was, I think, 11% last month and 22% plus this month. And when that happens, it may not be anyone's fault. It just happens, and it's something that we need to try to figure out a little better, to predict a little better, so that we don't end up in a situation. And yeah, we're financially, I'm not saying financially we're bad right now. We've got plenty of money in the bank. We've got good projections. We've got a lot of good things going. But I look kind of towards the future, and when I see just a remnants of a small problem that could balloon up into a real huge issue if you don't nip it right away. And that's why I'm bringing it to the attention that it is a very, very important issue, in my opinion. I would hope that everybody would be on the same thing. I think they are. We have to find a better way to screen or be able to predict.
Is there a need? I'm sorry. Go ahead.
I would like to add one little piece to this whole thing. Nobody knows what the government is going to do. Healthcare is changing if not daily, at least weekly and monthly for what is reimbursed and all kinds of things. And that's something we can't foresee because I don't know what they're doing.
I want to make a comment as well. I attended the finance committee just Monday. And thank you, Commissioner Spikers and Commissioner Dario, for doing such a due diligence and looking and weighing every possibilities and even those impossibilities to make sure that we are on track. And making sure that we're financially sound. Thank you.
Are you ready to do the warrants?
This lies, you understand that we talked about true band when the time comes.
Okay.
Okay.
Additional question, following up on the finance committee and the comment I made to Tom earlier. Isn't there a change in reimbursement at 21 days for Medicare patients, and what is that?
Medicare beneficiaries have 100 days of post-acute care benefit. The first 20 days are full reimbursement, and after 20 days, they start incurring a 20% copay for the last 80 days of their benefit.
Thank you.
Okay, Commissioner Spikers?
Just make at this time, unless there are further questions about the finance minutes, I would go ahead and make a motion to approve the warrants. So, and I just want to say that there was a 3 payroll month, and that's why we have quite a bit more in our warrants this month, and that does happen about twice a year. So this is the month.
Is there any other discussion on the warrants? Okay, then we'll now take a vote. All those in favor of approving the warrants, payroll taxes for April 2016, please say aye. Aye. Are there any noes?
I oppose.
Okay. The ayes have it. The motion passes with Commissioner Pollard voting no. Next on our agenda is the medical committee, Commissioner Young, and I don't know whether you or Emma are doing it. Who's doing it? Okay, all right. You have the floor.
All right, just gonna hit kind of the high points. We have established a policy on medicinal marijuana use by patients and confirmed by the pharmacy and therapeutics. There's a general prohibition of its use with a path for petitioning for medical exception. It's a work in progress. And I think we've talked about how many people are here. We do have an extended nighttime hemodialysis for swing bed patients has successfully launched. And I think Dr. Wickoff, and I don't know if anyone else, went to represent our service at a nephrologist conference in Linwood in May. We're still continuing to reserve an inpatient bed for ED use and continuing to refine our procedures for using the 25th bed to maximize access for local residents, both through the ED and into a swing bed. Our IV solutions, pumps, and tubing conversion is expected to reduce costs by $1,200 a month. Emergency is still running year-to-date 10.5 a day. They're budgeted for 11.8. And they're nearly ready to launch a program to make Narcan available in take-home packs. Maybe you have any questions you can ask me when I get through. Imaging, prior authorization capability for imaging starting in June. That means that it won't take as long to have your insurance authorization to allow an x-ray to be taken. They're working, and that could be endo procedures also. We're working on, and they're working on, a nurse call response system, reporting software, basic system is operational. The reporting capability will be improved. Will allow for analysis on our performance on responding to nurse call, which is helpful. We are working collaboratively collaboratively with ProLiance on their joint replacement bundled payment program with the intention of supporting them in their requirement to manage overall costs by assuring the correct pairing of patients with our swing bed program. And just to add, we have a parking lot for contributions to strategic planning, which include considerations for findings from an updated community needs assessment, prevention of physician burnout, and the updated community needs include home health and home health care, and a transition to value-based contracting. Any questions from commissioners? Yes.
With respect to your last comment, or your last, what is a parking lot for potential contributions? I don't quite understand that.
Well, we talked about subjects that we would like to have.
Yeah, what is a parking lot though in this context?
It's a
This.
list of ideas.
Oh, I just never heard that term
Yeah.
used.
Well,
Or-
now you have.
Now I have, yeah, right. Okay.
You tried this.
Other questions, with respect to patients using marijuana, under waiver and so forth for medical exception, how extensive is that
It's not.
in terms of actual usage of marijuana in the hospital?
Now we don't allow
We don't know.
Okay, and then it says policy used by, it's not clear that it's not allowed. It just says that there's a policy,
The policy.
general prohibition with path for petitioning for medical exception. And that's what I was asking, medical exception, use of marijuana. Are we doing any of that, or do we have any experience with that?
what's being.
Maybe she could come to the mic to.
Dr. Leacock, would you come to the mic, please?
So that's, what you just read, Mr. Pollard, is exactly what was presented to the medical committee, and that, a policy has been put in place that makes it very clear that it's, a general prohibition against the use of marijuana in the hospital. But there is some clear times that, the therapeutic application of marijuana. And, so we did want to make sure that there was a path to that occurring in select patients. So the policy was put together in light of the state's recent change to legalizing marijuana.
Would I continue to ask of this question, and that is, how does that impact other patients in the hospital, or whether this would be perhaps ill, or
We continue to advocate that there is no smoking in our facility, so the only allowable medicinal application of the THC, which is medicinal marijuana, is either by way of oils. It can be ingested, but it cannot be smoked. It can't be smoked, it can't be vaped, there's anything that is aerosolized, because that may have impact on other patients or our staff.
good, thank you.
Thank you, Dr. Leacock.
Okay. I was saying, might as well stay up here for medical credentialing.
Well, I have some additional
Oh,
questions.
okay.
Well, does anybody else have any questions? Commissioner Pollard asking more questions. Does anybody else have any questions for medical committee or for Dr. Leacock? Okay, Commissioner Pollard?
Well, I'm just curious, it says that we were invited to represent our new service, that is the hemodialysis at a nephrologist conference in Linwood on May 13th. Did we go to that? And was there anything to report from our participation?
Yep.
Okay.
It was relationship building.
Here, but then the same category, IV solution pumps and tubing conversion expected to reduce costs by $1,200 a month. What is that conversion? What are we talking about?
From one brand to another,
From what?
one brand of supplies to another brand of supplies.
Oh, okay. So what the conversion is to switch brands, essentially. Is that correct?
May I comment on that?
Yes, Tom, our superintendent, H.
Thank you. The cost savings quoted there are the supply costs, And we're also still looking at the total financial impact because there are different lease costs for the equipment. And so we're not quite done with that project yet, but we will see a significant cost savings on the supplies, and that's both the tubing and the solutions. So more to come on this one.
So any other questions from any commissioners? You still have another question?
I still have a question. Regarding social work here, it says recruiting for open social worker position. Is that an additional social worker position?
We had a social worker leave several months ago, and they're still working on finding a replacement person.
Okay. How about the status of the Xenix study? The Xenix machine, for those who don't know, is a device that we use in the hospital to zap bad things.
We just completed that study where we took a look at bacterial colonization on certain surfaces after we had done what we call a terminal clean, and then after we used the Xenix. The satisfying result of that is that our housekeeping staff is doing a phenomenal job. And we concluded that for right now, given the way that the technology continues to move forward in using light rays of various kinds to kill bacteria, that we want to take a pause on using that technology. Nothing wrong with Xenix. We believe it does a great job of, it can break down the cell membranes of bacterial cells like nothing else. We believe in that research. That said, we also believe in the capabilities of our housekeeping staff at this point to be able to continue to keep us at a very low rate of infection. And so we're going to watch what this technology does. We're going to discontinue use of Xenix according to the terms of the contract. And I was reviewing the contract this week, and I'll be asking Xenix for an early withdrawal on that lease, and I'll let you know how that goes.
How much will we save?
It's about $3,500 a month. Contract runs through November 15, and I'd like to end it early, and I may have to do a little negotiating with them on that.
Good. Excellent. I have further questions, Madam Chair.
I have a question. Do we have a comparison yet between what Xenix does and the hospital staff? Have you?
That's exactly what, yeah. And we saw no discernible difference for the surfaces that we cultured.
Okay,
And
that's
so,
what I was
yeah,
asking.
and so the
So you
staff
know-
are doing a fabulous job.
Okay, thank you.
Yeah.
Yes, Mr. Pollard, you have another question?
I'm embarrassed to say I don't know Dr. Gray, and so it says new MA hired to support Dr. Gray in the clinic. Who's Dr. Gray and what clinic?
Gray is in the Ridge Clinic.
Pardon?
He is a internal medicine doctor,
Family practice.
family practice.
Okay, that's listed under clinics.
Mhm.
So is that the family practice clinic or what
One of the
clinic?
physicians in the family practice clinic who's quite busy.
Okay, down below, there is a mention of updated community needs. That must be what you were talking about, Tom, about the survey that Mr. Ballard's going to do prior to, no, that's different. Okay, excuse me, could you clarify what that is?
That's good.
Okay, thank you. So that's another piece that will be used for our strategic planning. What this is, as you may recall, I had gone through the community health needs assessment done for Overlake and saw that there was a lot of data in that specific to our hospital district and the service area of the district, and it asked for a pared down version of that report that was just specific to our district. I just received that report from the consultant. I want to go through it to make sure that it is accurate. And as soon as I do my review on that, I will send out to all commissioners and the executive team.
Excellent. And you did mention that verbally to me somewhere along the way, but I was just concerned that we weren't talking about an updated community needs survey in the community, which we will do later, but the one we have now is out of date.
The one we have now is out of date, and that's why I chose to get the, what I would call the Snoqualmie version of the study that was done for Overlake, because we could get it done in time for our strategic planning. And again, I'll be providing that to all the commissioners once I've finished my initial review.
Is there any other questions or discussions for the medical committee? And we will move on. Credentialing.
Right. On May 18th, the medical executive committee met. They had a light agenda. There were 3 courtesy staff members that were due for re-credentialing. All 3 of those, their packets were reviewed and no issues of concern and recommend approval, and I'll read their names for you. Dr. Patrick Cox, Dr. Dawn Hausretter, and Dr. Ross Andersma, and these are all teleradiologists. There were also 3 resignations. These 3 positions also are teleradiologists, and they are leaving the group, so no issues with us. Those positions departing are Dr. Castagna, Dr. Manchanda, and Dr. Marks, and no action is needed from you on that. That's information.
Thank you.
Approve credentialing as presented.
Second.
All those in favor say aye. Aye. Yeah, those that oppose say no. The ayes have it. All righty. Next, we're moving on to Facilities Committee. Commissioner Pollard, would you like to report on Facilities Committee?
Yes, thank you. We have actually a 4-page report tonight, so we've got to save time. We've got a lot still on the agenda. I will just hit a couple of the high spots. The copies of the Facilities Committee minutes, which constitutes our report, are over on the table. A couple of interesting things, and that has to do with the flagpole situation. If you, last time, well, you remember going to the hospital, there was a nice big circle, and that was going to be the place for a flagpole. And we had the scouts lined up, and the money is paid for and everything. And then we found that that's city property, and they won't let us put a flagpole there because an emergency vehicle may have to run across that circle. So that squelches that idea. I think Tom could maybe tell us a little more articulate fashion what our prospects might be for a flag and also better markings perhaps to the entrance.
Happily. We took a look at 3 alternative locations for the flagpole and determined that there is as you face the front door of the hospital, just to the right, there's a interesting, almost a peninsula of sidewalk. It's more sidewalk than is needed for pedestrian traffic. And within that little peninsula there of sidewalk, we've identified one square of that concrete that would be perfect for placement of our flag. It would be seen easily as people drive up to the hospital, and well defined already by the square of concrete. So we would actually our scout, our Eagle Scout candidate, has arranged for a concrete saw and jackhammer, and he will not be running himself. We confirmed that today. But he's going to get help on that, and that's where a flagpole will go. The other advantage of that spot is that we'll be able to light the flagpole from a spotlight mounted at the hospital wall where we have power, so we won't have to string power to that spot. So at this point, that's our plan for the location of the flag. I think it's the best alternative to having it roundabout.
It's going to turn out maybe better than we thought because of that issue of lighting the flagpole. We were scurrying around about tearing up the sidewalk, putting in solar lighting and all of that, and that's not going to be necessary now. So sometimes things turn out better than expected. Okay, I'm going to just skip.
I'd like to make a comment. I noticed here the fireplace that there's a comment here that has been determined that there could be a significant savings for cost of gas if the fireplaces were not turned on during the summer months.
I
Therefore,
was going to mention that as part of my report.
yeah, I think that's an excellent idea. I
Yeah,
applaud that idea.
so, yes, if you remember, there are decorative fireplaces on first and second floor lobbies. And they do look pretty, but they cost a lot in gas. So we came up with the idea that there's no point in having them when the weather outside is warm, bright, and so on. So Tom has calculated, his staff has calculated we'll save thousands of dollars. And we must remember that we have some special lighting in those fireplaces too. So if we need to save more money, those fireplaces are decorative without gas actually being pumped through there. So, is that right, Tom?
Correct. Each of both fireplaces also have low voltage LED lighting, and so we'll be able to leave the lighting on. We just don't have to run the flame in the warm months.
Yeah, thank you, Madam Chair, for bringing that up at that point, because that is very good. Now, the healing garden, which was part of the original design of the architect and so forth, we've had trouble getting that in shape. But Tom met with the president of the foundation, and the concept of using arborvitae for the wall of the healing garden may solve the problem we were facing, which is a separation from the parking lot and yet development of that healing garden. And the good thing is that Absher, our contractor, is working with us on getting that done. And I might just add one thing, and that is regarding the arborvitae. It might be good if we talk with Terry Fine and ask, is that the best thing to plant? There may be an alternative or two. So, okay. Traffic safety. I don't know how many of you have come out of the hospital parking lot and wanted to turn uphill, turn left, uphill, and found that your sight visibility there is limited. And the way those cars drive down the hill, you might have only a few seconds to react, go, no go. So Tom has worked with the city on this issue, and there's not an easy fix because the barrier that's causing the visibility problem is also necessary for safety. So we haven't solved this with the stop line has been moved a little bit forward, but my experience is that you have to go beyond even the new stop line to be able to see the traffic coming fully. And a lot of people are going to be hesitant about getting that close to the oncoming traffic for visibility purposes. So we have not solved that problem. Anybody that goes up there and makes that left turn and wants to comment, let us know. But I find it hazardous myself. Tom, you want to add something?
Oh, I agree. It's a challenge. And so the next best, notwithstanding a whole roundabout solution, which I'm sure is way off, but I've asked the police department now to get back to me on the idea of having some speed strips on the lanes coming down the hill. I'm just waiting for feedback on that. I'd asked the folks who had helped do the assessment on the guardrail, and they said that's really something you want to ask of the folks over in law enforcement, so I've posed the question there.
Excellent. Okay, there are more items in here that are interesting, like the dog daycare program that's being considered by the parties. The gift shop is expected to be operational on the 1st of July, so that's just 30 days out there. That's just a one-line item. There are more items that you might want to look at, but probably the most important thing that was decided, or rather considered as a recommendation for the board that occurred at this meeting has to do with the fireworks stand. We had received complaints from many people including officials, that it seemed incongruous for the hospital district to allow some of its property to be used for the sale of fireworks. And so we looked into this, and I expressed myself very strongly in the meeting that I thought that this was a mistake from the beginning, and we should not allow it this year. But Tom, being a more reasonable and likable person in many ways, said we don't need to have that kind of confrontation, with Kiwanis. Kiwanis does good things. No problem. I'm a former president of a Rotary Club. I know service clubs do marvelous things. That was never the issue. Kiwanis was never the issue. It was the issue of what does it look like when a hospital is allowing its property to be used for the sale of fireworks? The hospital is right across the street. Are they soliciting business for their emergency room? I mean, big questions like this were coming up. One county official said, it seems oxymoronic. So, at any rate, Tom wrote a very good letter on this that I think is going to constitute our recommendation to the board. Tom, would you mind reading? Go ahead and read the letter. It's nicely done.
I think we have that as a resolution later.
Yes, you want to,
So we
the
should
letter's
probably-
not part of the resolution, however.
Let's wait till we discuss it.
When we go through the resolution, that might be the time to read.
Okay, that's fine. Well, that constitutes a report of the Facilities Committee, Madam Chair.
Thank you, Commissioner Pollard. Okay, executive session. We had said we wanted to have an executive session. I believe this is the time that we would like to do it before we go on to new business. Is everybody ready to do that?
Yeah, it might be a nice break for the audience as well.
No, I have a protocol. Can we go upstairs? We didn't get permission to go upstairs. Do we have to empty out this room? How do we do
It's
that?
most likely open, we would just need to check.
Okay.
We have the executive session language that you have to, under RCW.
Yeah, I don't have it. And let's see. What do we say? We
Under
say
the
under
RCW, we're going to be discussing employment
Oh, got it.
issue.
Got it. Under RCW 42.30.110, the Board of Commissioners of Public Hospital District Number 4, King County, is authorized to go into executive session to discuss and review personal matters, and specifically to review the performance of a public employee or employees. Pursuant to this authority, the board will now go into executive session to review personnel issues. It is anticipated that the executive session will be concluded in approximately 20 minutes. Is that what we decided? And no final action will be taken during this executive session. So we will be excusing ourselves, and then we will return in about 20 minutes. Yeah, it was going to take us a couple minutes to get up there first to make sure. Our executive session, and we are moving on to old business. Now we will take up the old business and consider resolution number 506-0616, approving appointment of a permanent superintendent CEO. This resolution was introduced at our May meeting. Note that for all items under this section, we are only discussing now and will take a vote after public comment has been received. Val, would you read the resolution for us, please? The clerk.
Resolution 506-0616, a resolution of the Board of Commissioners of King County Hospital District Number 4, King County, Washington, approving the appointment of Tom Parker as permanent superintendent and chief executive officer. Whereas pursuant to RCW 70.44.003, Public Hospital District Number 4, King County, the district, is a public hospital district authorized to own and operate hospitals and other healthcare facilities for the public purpose of providing hospital services and other healthcare services to residents of the district and to others. And whereas on or about March 18, 2016, Tom Parker was appointed interim superintendent CEO of the district, and he has continued to serve as in an interim role since his appointment. And whereas pursuant to RCW 70.44.0701, quote, "Appointments and removals of a superintendent shall be by resolution introduced at a regular meeting and adopted at a subsequent regular meeting by a majority vote," end quote. And whereas in compliance with RCW 70.44.0701, the Commission introduced this resolution appointing Tom Parker as permanent superintendent and chief executive officer of the district at its regular meeting on May 5th, 2016, with the intention of approving this resolution at its subsequent regular meeting on June 2nd, 2016. And now therefore be it resolved by the Board of Commissioners of Public Hospital District Number 4, King County as follows. Section 1, appointment. In compliance with RCW 70.44.0701, the Commission introduces this resolution appointing Tom Parker as permanent superintendent and chief executive officer of the district at its regular meeting on May 5th, 2016, with the intention of approving this resolution at its subsequent regular meeting on June 2nd, 2016. Section 2, severability. Should any section, paragraph, sentence, clause, or phrase of this resolution or its application to any person or circumstance be declared invalid for any reason, or should any portion of this resolution be preempted by state or federal law or regulation, such decision or preemption shall not affect the validity of the remaining portions of this resolution or its application to other persons or circumstances. Adopted by the Board of Commissioners of Public Hospital District Number 4, King County, at a duly and properly noticed regular meeting thereof on the 2nd day of June 2016. Would be signed by all commissioners if adopted.
Thank you.
On the point of order, Madam Chair.
Yes.
Did I miss something, or the way the agenda was supposed to go was under new business, and that's where we are now, is it not?
No, this is old business as we went ahead and appointed. We have not accepted this resolution. It was a temporary appointment until this resolution was actually adopted.
We didn't have it in writing last time, but yes, we announced it last month.
It's also listed under new business, is it not?
It's under action items.
Okay, under action items, okay. All right, now, at what point, if at all, will we give them an opportunity to discuss the employment agreement?
That comes under new business. That's resolution, let's see. The employment agreement is resolution 507-0616.
So then that would follow the quality improvement update.
Yes, that's correct.
Thank you for clarifying.
Okay. I believe now is there any other discussion? Hearing none, we will move on to the new business of quality improvement. Dr. McCuff, would you like to share this with us?
Get my slides up. So this is the quarterly quality improvement report that we bring to you all. So again, this is coming directly to you from the Quality Steering Committee. So Joan and Jerry will sit on that committee with us. So I'll let, as Val gets us up and going. So I intentionally did some opening repetition so that you see a lot of the same thing when we do each of these presentations. And again, what we're going to review is the information that has been publicly reported for us. Thank you, Val. So just a quick reminder of the organization. So you all, as the Board of Commissioners, represent governance. And in the
Excuse me for the interruption.
it's okay.
By the way, as long as I interrupt you, are you also going to talk about ACO? I think that was mentioned by the president. So that was not going to be part of this.
No, and Joe, Commissioner Pollard, I want you to know, this is the stuff that we saw at the meeting we were at.
Yeah, but earlier you mentioned that when she made her presentation, that she would talk about ACOs today. That is not correct?
That's not
Okay, thank
right.
So again, the QI Steering Committee represents oversight, looking at work that we do in the QI world in detail, and then the QI Committee and all of the subcommittees beneath.
And just a reminder of quality assurance and quality improvement are the two areas that we are looking at right now. Quality assurance is much more about what we report out, meaning that there has already been a benchmark or a standard of care identified, and it's about us maintaining that standard. Whereas quality improvement, you're looking to move towards a goal. So we actually have an opportunity to talk about that as we go over the information. So the things that we externally benchmark are through the Washington State Hospital Association Partnership for Patients. The CMS MVQIP, Medicare Beneficiary Quality Improvement Program. So again, repetition so that these become familiar acronyms in the alphabet soup of the world of medicine. And then the Washington Regional Rural Health Collaborative also has some benchmarking that we do. I call that external because we do share it among the 13 hospitals. So the Partnership for Patients, so that's what P for P stands for. The areas that we report into for this program are healthcare associated infections. So historically we've reported into 2, and that's urinary tract infections and bloodstream infections associated with a catheter in both cases. And the new reporting area is antimicrobial stewardship. This is an area that is getting great attention, and great momentum is building at a national level. In fact, it is now a standing part of the leapfrog review that is done as an assessment for quality, wanting to know if you have an antimicrobial stewardship program formalized in your facility. And so we actually are just slightly ahead of the curve. We've had an antimicrobial stewardship program going on for almost a year now, but it really has taken us that long to get it up and going. And we're really just about at a point that we're pleased with it, and it'll sustain us until the new program of antimicrobial stewardship at a national level is sorted out. Everybody's still actually figuring out what is the best way to do it. So right now, for Partnership for Patients, what they're really measuring is how long do your patients stay on antibiotics, or how many of your patients use antibiotics. Really has not matured to the question about, was it the correct antibiotic? Was it for the correct duration of time? Our program does that, but this doesn't measure that. But at some point in the near future, maybe somewhere before the end of the year, I would love to come and give a presentation really on what our entire antimicrobial stewardship program looks like. Because again, this is a huge issue in the world of medicine, because antibiotics, while they have been amazing and have been a life-saving therapy, have also become the detriment of us, and are the reason why we have so many super infections in our organization or in our facilities, why we need to consider Xanax machines, things of that sort, because our organisms have become so robust as a result of their antibiotic exposure and the genetic mutations from that. Adverse drug effects is another area that we look at here. Falls and pressure ulcers. So just a summary, and so we'll go into those areas. So these will hopefully be familiar reports, because there's the reports that come out to us from WSHA. And so I've highlighted where we are. You'll see we're way over here on the right, and this is not a desirable place to be. We have been over here before, and when we look at the numbers, we realize that it has to do with the way the ratios work for us as a smaller organization. In this month, or this quarter, excuse me, it actually is not the numbers working against us. We actually have identified that we had a problem. And so there, as I did the introduction, I talked about QA and QI. And so because of this, a QI project has already been launched. It's a month into its development already. This was a May 2016 release, so the beginning of May, we saw this information came back to us. We had a program up and going, so looking for that to fall. I don't have an answer for you at this point in time. That's part of what is being worked on right now, is understanding what is the contribution to this. Is it spurious? Is it an internal problem? So more to come. There's not been any detrimental patient outcomes, just to assure you on that. But nonetheless, it's not, you don't want urinary tract infections.
What is the rate? I mean,
Yeah, I would have to pull it for you. So here's the rate right here. So it's 12 per 1,000 patient days, I think is the number.
So if someone one patient has that each day and they're there for 30 days, that counts?
As one patient. So it's per patient, per number of patient days, so it's per everybody's patient days combined together, but the top number, it's only one person at a time. So even if one person had it for 12 days, the top number still is one. All 12 days that patient was there is on the bottom number. It's not an incredibly intuitive ratio. Everybody agrees with that. This, though, is not locally generated. This is a national measurement tool. So it actually comes out of the CDC. So it's not
We were
local.
like right at the lower left for
For a while,
a long time.
no,
And then
on this,
last quarter.
on
it
this
bumped
measure,
up.
yeah, no, on this measure, we've always had a result. It just, the patients that we deal with, they're pretty sick, and many of them are not getting out of bed. Many of them have catheters that are prolonged, and even though we follow protocols and standards, they still get infections. So we're just asking, we're being very honest and intense with ourselves and saying, despite the fact that we're doing what we feel like we're supposed to be doing, something's getting past us. What is it? I'll have a follow-up for you because none of us are
Okay,
satisfied.
for next month, the follow-up?
I won't promise it, probably in the next 60 days, definitely. But by the next board meeting, sometimes it takes, you do an intervention and then you measure, and you do an intervention and measure. And so it may be second or third iteration before we finally realize that was the solution.
If you think about it, utilities on an antibiotic and then you get off that product. So it's,
3 weeks.
yeah,
So, and you've got to have an enough number of patients come through in order to see a statistical change.
Now, if some of these patients come in with an issue?
No, they do, I'm gonna answer you two ways. Yes, they come in with all kinds of issues. If they come to us with something, then it does not count in our numbers. So those are, they are excluded from the top number. They're included in the bottom number. This is catheter-associated bloodstream infections. The catheter, though, is a vascular catheter. And so here is where we always are. It's way down here. Nice numbers there. And so this has everything to do with the protocols that the nursing staff uses when they're changing catheters, when they're touching these central line catheters. So again, nice testimony to their process. So this is the new measurements. So we are all learning, this is all learning how to interpret this and where we stand. So this is on antimicrobial stewardship. And what they do is they have in this report, two varieties of antibiotics that are being measured. These are two classes. This class is the cephalosporin class. And you see we are right here in the middle as far as our utilization rate. As WSHA uses this more, this is very introductory. This needs to mature into asking questions like, so you used it for a certain number of days. Was that the right number of days? Was it too long, too short? And did you use it in the right instance? So that will all come, but that's going to be probably 24 months before that gets matured. And then this, again, same question, same measurement, just a different class of antibiotics. And this is the penicillins class, not just straight penicillin, but this actually encompasses a pretty significant class. And so you see we creep up here just a little bit more. Now moving on to adverse drug events. Adverse drug events is a measurement, and it's in 3 areas. It's in the area of anticoagulants, in the area of hypoglycemic, so diabetes medications, and opioids. And what's being measured here in the anticoagulants is, did you have any times when the patient was excessively anticoagulated?
again, very dangerous because they're at risk of bleeding. In the second, you're measuring, did you have any diabetic patient who's on a diabetic medication and was their blood sugar at any point in time less than 50? So for the two nurses in front of me, you know that that's not a shocker, that somebody's blood sugar goes below 50, diabetic or not. But that was chosen as a measure. It's not a problem. It's not a problem at all. But so here you see that, yeah, well, we definitely had a couple of patients who were lower than 50. But again, not a huge number. And then this third area over here has to do with patients who receive naloxone. So that is a reversal agent while they are receiving opioids as a treatment from us. The naloxone is the medication that Joe referenced when she was doing the medical report of the medication that we're going to, right now, are starting to dispense it out of the emergency room because opioid overdoses is such a rampant killer in our communities. So this allows for bystander rescue. So we use it in the hospital too.
So I guess the adverse drug event, what does adverse drug event mean in terms of this particular program?
Any adverse drug event is an outcome of the medication that was not intended or expected.
Is it, maybe sometimes folks don't say what they're really on when they come in? Or, and then that kind of...
No, because these measures are only done in the inpatient setting. So that would be absolutely a lot of experience that happens in the emergency room setting. It's very common when people come in and they either aren't able to tell us or don't know what they took. A lot of different scenarios, but in the inpatient setting, these are all medications that have been administered by us. So yeah, so there's full knowledge here. So we, just to bring some clarity here, this big bar, that is one, the star at the top means that was one patient. Is what that means. So we are really intentional about limiting our narcotic use in the hospital. That so as we have fewer and fewer patients who are on narcotics, then when we have one who needs to have a naloxone rescue, then that makes it higher. But that is 1%. And I actually can't see who that is right there. Grace Harbor. So Grace Harbor, they also have a 1 star. So the two of us and one patient apiece. Inpatient falls with injury. So here we are, right here, no falls with injury.
I have to tell you, having worked rehab, you guys, this is great.
That this is one thing that's always been really, really good. I think I can only remember one event ever that was ever came to the board. And it was in a gurney or something like that. And that was it.
You never say never in patients.
No.
Remember, we do support patient autonomy. They refuse to participate in safety measures and they get up and they fall anyway. There's a limit there. So we are a no restraint facility. But what that means is there's only certain criteria where you can apply restraints, and like every other hospital is. But you are right. This again is a testimony to our nursing and our caregiving staff on the floors. They have a very low threshold for positioning a sitter with a patient. They do all kinds of creative solutions to try and keep folks safe. And then again, I'll just continue the accolades to our nursing and our caregiving staff on the floors, and that our patients, even those who are not able to move, who are not able to move themselves, they still are well taken care of in regard to skin protection, and so aren't developing ulcers, pressure ulcers while they're in our care. Especially for the length of stay. Exactly right. Any questions? Because this is the last one. For the CMS measures, the NBQIPs,
these are inconsistent about coming back, so there has been no updated reports, even though we submit them. So, which probably means next time I report to you, I'll have 2 reports to bring that we'll put together to all look at them and see what the wisest way of sharing them with you is. And then the Washington Rural Health Collaborative, again, there's a significant number of measures here, and the quarterly report just isn't ready yet. I even checked this morning, I was going to add them, but they're just not back to share yet. So I definitely will have 2 quarters worth the next time I come to present. That should be it. So, no questions? Are there any questions of Dr. Wittek?
Can you interrupt you right now?
Question. In the job description for the CEO, it talks about an effective patient satisfaction measurement system. We can talk about quality healthcare all we want, but what are we doing to hear from the patients? In recent months, I have received, and other commissioners have received complaints from patients who are not satisfied with the care they got at the hospital. And what are we doing to get information directly from the patients and their relatives, their support system regarding this? And what system do we have at the present time, and how can it be made better?
Patients, the system better? The monitoring system?
In order to
Maybe I'll answer the question first of what we have. So we have been a participant with a company called HealthStream for patient satisfaction surveys. As we were transitioning to the new hospital and in the months before that, with our computer systems and some upgrades, we lost our connection with HealthStream, and it has recently been restored. So we're back doing regular patient satisfaction surveys. And so that falls under quality. So the quality org chart that you saw. So now that is where patient satisfaction is housed. We participate in, and again, alphabet soup, again, but just so you hear it, HCAHPS, CGCAHPS, EDCAHPS, and those are, and then there's an outpatient measurement called outpatient CAHPS. CAHPS stands for the hospital satisfaction survey that's from CMS. The C is from CMS. So it's CMS, hospital satisfaction scores, clinic satisfaction scores, emergency department satisfaction scores, and outpatient services satisfaction scores. Outpatient for us is lab, imaging, rehab department, endoscopy, and infusion are our 4 areas. So CMS mandates that patient satisfaction scores, or satisfaction surveys, occur by way of telephone interviews, and they're highly scripted, and they can only be done by someone who is certified and trained in the CMS way of doing that, and you must be a certified vendor. This is something that we cannot do internally. You must do it through a vendor. So that is where a company called HealthStream comes into play. That's the group that we have contracted with to do patient satisfaction surveys. And so they are actively doing them because we've now got our connection with them restored. We are just now getting final results back with the next QIS meeting. We have full information and trending reports that we'll be able to review. So those will end up getting incorporated into subsequent presentations here in the board presentation. So by next quarter, they'll be ready to go.
Okay, further question.
Excuse me, does anybody else have a question before Commissioner Pollard asks another question? You may go ahead.
It's just a follow-up to that, and that is, I don't recall with these quarterly reports that we have ever seen data from HealthStream or whomever regarding patient satisfaction scores.
Correct, that's what I'm just telling you, is we are just now getting that back up and going, and so there isn't enough finalized information tonight to share with you, but by the time I come back in a quarter, then we'll have enough finalized information from being back up and going with them, that there'll be information to share. It'll have meaningful numbers because the N, so the number of participants will be large enough to have meaningful information. Yeah.
Well, just follow up again, my recollection over the years is we've never received those reports,
No.
even though we were under Kansas Health Spring, is that correct?
So they have, I can't recall either that they came up to the board level. They always came by way of QI steering was as far as they made it. But we have committed to going ahead and bringing it all the way to the board level as part of our committee, our quarterly reports.
Thank you, Madam Chair.
Thank you. Any other questions? Thank you. Okay, now we're moving on to resolution number 507-616, and it's approving superintendent CEO employment agreement. Now, we will consider this resolution approving superintendent CEO employment agreement. Again, please note this is only for discussion at this time. We will not take a final vote to approve the employment agreement until after public comment is taken. However, we may vote on amendments now. Take note, the amount of compensation in the attached employment agreement is blank. Each commissioner may make a suggestion about what amount they would like in the blank. This is just the amount, no discussion at this time. As soon as we have all made our suggestions, we will have a discussion and then we will vote on filling in the blank on the employment agreement. Commissioner Pollard, do you have a recommended what you would like to see in your blank?
I appreciate that, but my understanding is it's a two-step process. That first we do 507-0616 to approve the employment agreement. But the second step would be to discuss the salary, and that's the other 508-0616. So the first.
Isn't this salary in the agreement and the,
Yeah, not at this point.
I think we have to talk about both. So,
Well, they're two separate
right,
resolutions.
voting will be separate when it comes to it, but I think if you're going to have comments on the agreement and or salary, it probably should be done.
I would suggest that we take them in the order they appear on the agenda. That's what you do.
that's what I'm doing.
Good. Well, then 507-0616 does not include salary information.
Well, no, we're amending that to fill it in. That's not in it.
We do that with the second motion or the second resolution.
Well, I don't believe so.
I think you're a little, if I may, if this is okay, I'm trying to clarify for myself too. I believe that when we discuss the agreement, we have discussion about the agreement and the salary together. And under the action items,
Yeah.
we would be voting one to agree to adopt the agreement and put that into use, and then two, to also make recommendations and vote for the, or not make recommendations, but vote for a salary, a set salary.
The parliamentarian thinks that you can explain it for us.
Okay.
So if I may, the way that we have set this up is this. You have before you a resolution approving the superintendent CEO employment agreement.
Right.
It has a blank line where the salary should be. So what we have proposed is that first, we will amend this resolution before you now to fill in the blank.
Well, that would
We
be
will
the
fill
first
in the
step.
blank, that's the first step.
Oh, that's good.
And then we'll have discussion on the resolution and agreement. Then we'll take public comment. And then after that, under action items, we will vote on the resolution to which the agreement is attached with its amendment.
Okay, then.
But on the action items, the first one is appointment.
Yes, that was
The second one is
correct.
employment.
Yes, sorry.
Okay,
I
just
skipped
wanted to
that.
make sure
Yes,
we-
no, that's absolutely.
Very important here.
But the method that we've proposed is one that your parliamentarian has found to be very effective for filling a blank. It's a method that Robert's Rules suggests when you have various numbers that might be considered. And what you do is first you collect each person's suggestion, then you discuss them. Each person makes the argument why a particular level would be good, and then you vote, and the first number that receives a majority fills the blank. Now, that doesn't mean that it's approved, because you're still going to have to take the vote on the entire resolution with agreement. But settling the matter of the salary first will prove, in your parliamentarian's view, to be very effective.
Is there any other discussion or comments about that? David, what?
I just, it seemed like the cart before the horse to me. I want to make sure that there was an agreement, that we all agreed on the agreement, and then,
Then the salary paid out.
so, that's fine.
I just say that I talked with, or communicated with Jay Robbie about this. He might.
Could you speak closer to the?
I'm sorry. I discussed this by email with Jay Rodney, and as I understood it, it would be a two-step process with approval of the appointment first, then the salary, and then they would be combined. But perhaps that's not correct.
Council was present when we planned this.
Yeah.
I'm gonna say, we're under discussion now. The vote is in another category.
I realize that.
Yes.
Discuss both things at once.
But it is proposed
Yeah.
to discuss and vote on the salary now at this phase.
Because the contract comes with the salary.
Okay, so it's no longer discussion, it is to vote on the salary.
Only on filling the blank, on arriving at a commonly accepted number, which will still be a draft as long as discussion continues.
Okay.
Until once we come to a number, we will put that in, and then we'll vote on the contract later with the number in it.
And as was mentioned, that we each have an opportunity to give reasons for the number that we propose.
Yes.
Thank you.
It says we will discuss the levels suggested, and we may each speak twice, and I think I read that before. Okay, so why don't we go in order, well, Commissioner Pollard, I have you down first on my list. Do you have a number that you?
Yes, I can propose a number, and the number I would propose would be $196,000. And at what point would there be a discussion, or should I make that now?
Let's get everybody's numbers down, and then we will have discussion.
All right.
Okay. Commissioner Hillard.
I propose 220,000.
Okay. Commissioner Spikers.
I propose 220,000.
And Commissioner Young.
220,000.
And Commissioner Norris, President, I also said 220. Okay. And then we won't do anything next. I guess we do have discussion. Okay, Commissioner Pollard, would you like to?
Yeah, the reason I'm proposing 196,000, well, there are several reasons, but we have to remember we're $100 million in debt, long-term debt. And I think it's good for us to set an example of some measure of austerity. In 2014, Mr. Parker earned $142,542. All this is public information, by the way, and these figures are from the State Department of Health. So in 2014, Mr. Parker earned $142,542. He's currently earning $174,200, which was the salary of the previous CEO or superintendent. Okay, so I think moving it from his present salary of $174,200 to $196,000 is a substantial and sufficient increase. With respect to the comparisons that have been made with other hospitals, the information we got from the personnel department is really not usable because there are no comparative hospitals at all. There's nothing that compares with our hospital in terms of those that were listed in the salary survey. As a result, we were in a position of comparing ourselves with a full-service hospital that has surgical centers, branch campuses, OBGYN, and you know, vast amount of services, whereas by comparison, our variety of services, or our scope of services, is much more limited. At any rate, I'm just saying that to say that the salary survey that was done on which the 220 is based is not valid. And therefore, I think we need to set an example, and I think the community would be appreciative of our paying no more than is necessary, and I think $196,000, which is an increase from his present salary of $174,000, is sufficient. Thank you.
Commissioner
I propose to 220,000, given the fact that we won't have a COO. That saves the district $174,000. And the second is that he has demonstrated the skills and the knowledge required of a CEO in the recent months. Thank you.
I would like to pay nothing for anybody, but that's just not the case in today's supply and demand. And but Tom, there's human factors here involved in his trustworthiness. There's comparisons that have been made with other hospital districts in the Northwest that have ranged from 150 to 350,000 in salaries for CEOs. Given that he has a different type of group of problems than maybe some of the other CEOs in other districts may have, and they could be a little bit more challenging in a different way. So I believe that I think he's up to the task, and what I've seen, there's been some quick changes that have saved some money right off the bat. I'm hoping that that what we expect of him, he will continue to keep us happy and surprised, happily surprised. So I give it, the type of person he is, and based on actual analysis from looking at other hospitals, this is a very expensive place to live. And we had, just to let you know, that we had a clinic manager that was going to come out here, and when they found out how expensive it was to live out here, they said, "Sorry, I didn't know it was this expensive. I'm going the other way." So, I think I believe that he is capable, and we can expect a lot from him, and the savings that we've seen so far, and then the savings that we're going to continue to find with the COO non-payment. We won't have a COO. So those are the reasons.
Joe?
Okay, I would say ditto to all of that, but also to include that he's been around the barn a few times in some other instances and has some different perspectives that I'm looking forward to seeing more of. 220,000.
My rationale is that the district has been underpaying its superintendent. Unfortunately, that was the case with the previous superintendent. Tom is also taking on two jobs, the COO and the CEO. Cost of living in this area is some of the most expensive cost of living throughout the state. And he has definitely demonstrated, probably the most important thing to me, is that he has demonstrated to the board, and particularly to the finance committee, that he's willing to step up to the plate and to help us be more fiscally responsible. And we have been trying to get that for 2 years, and that hasn't happened. So based on that, I support the 220. And anyhow, So that's our discussion.
I think you said everybody could
You
speak
can
twice.
speak twice, so you may go ahead and speak, Commissioner Paul.
Well, let me just say at the outset, I consider Tom a man of integrity, an honest man, an admirable person, and I consider him a friend. But when we start doing things on the basis of our personal friendships, that's called cronyism. And this is one of my main concerns with whether Tom can make the changes that are necessary in our district, because I believe that approximately $20 million of that $100 million that we owe, and another person who's much more skilled at finances than I am has calculated it at $30 million that is related to two problems we've had in the district: transparency, or the lack thereof, and cronyism. So while I have the greatest admiration for Tom Parker, and as I say, I consider him a friend, he's such a nice fellow that I'm not sure he could deal with the deep-seated cronyism that has built up in this district over the last 12 years. And the problem is that we need to make change. It takes a certain level of, may I say, incompetence perhaps, or whatever, to bring us this little 25-bed hospital to an indebtedness of $100 million. Bill Tilden's a famous British tennis player. He says, never change a winning game, always change a losing game. We've been playing a losing game, and we need some major changes. And while I can hope, I'm not sure that a person who's been part of the executive team and therefore part of the decisions that has led us through this debt would have the strength to actually deal with it. Now, since he is such a fine fellow and he's trying to do the right job, I'm hopeful. But that is one of my reservations. With respect to the salary itself, the idea of, first of all, the salary survey only included critical access hospitals. That means 25-bed hospitals. We're not talking about these large hospitals where they're paying the CEO over $1 million. The data that was provided to us, I think the most expensive comparison that they gave us, and this would be for a hospital that really is not a match, it's not really comparative because they have full service surgical, obstetrics, gynecology, all kinds of services for seniors, not comparative. And at any rate, the salary survey that was given to us for critical access hospitals, 25-bed hospitals, I believe the highest salary was $260,000, not $350,000. So I think it's important to correct that. Those figures are available publicly, and if anybody wants to check them. At any rate, I just want to say that I'm very much in favor of appointing Tom, but I think Tom Parker, and he's gotten off to a really good start, no question about it. But I think the job's worth $196,000. That's $20,000 more than Roger was making. So, and as far as Roger being underpaid, he was paid at the midpoint by previous salary surveys. So I don't think that will stand up. At any rate, the current salary for Mr. Parker is $174,000. So I think $196,000 is a substantial increase. With respect to the COO and the fact that we're not going to replace that position, I believe none of the comparisons that we looked at had a COO. So our mistake may have been to have had those two positions rather than the board giving more direction to the CEO and not requiring that position. It's almost like saying, you know, this was a position we didn't need, in which case, you know, that has its own implications. But at any rate, I very much want to see Mr. Parker be appointed permanently, but at a reasonable salary, which I think is $196,000. Thank you.
Commissioner Herron.
We are a district that is not perfect. Cronyism has been the old story. Let's give our new superintendent a chance. He is an individual. He makes up his own mind. It has nothing to do with who he worked in the past. Let's not be hypocritical here. To try to save money and promoting a COO where the interim superintendent can handle both, I think that's saving the district money. So you have to, if we prefer to have another COO, that's more than 300,000 that we're going to be paying if they have both of them.
Thank you. Commissioner Stockers.
Yeah, and I think starting off on the right foot as a board with the new CEO is a very, very important to our destiny. And if we would have went the other route and looked outside to do a professional job search, it would have probably cost us at least $100,000 to do that. And 6 months, and Tom might have found another job by then, or something. He might have said, whatever. There's so many unknowns. This way, we made a decision to continue continuity as far as the personnel that work here, and to try and turn a new leaf with finances, which he's already committed to doing. He's told us so, and I think he's very good in operations, and that's what we need. We're tweaking operations right now. There's a lot of things coming down the pipe, and I'm confident that he can do the job, and he will be well worth the $220,000 if he saves us a few $100,000 in the next year, which I'm thinking he probably will. So that's it.
I don't think I have anything to add to what Karen and Mr. Spikers has said. Let's go forward.
I don't think I have anything else really that I can say. I appreciate Commissioner Pollard's concern about spending money. And I probably would be more in line with him if I didn't know that we had eliminated a position and that he is taking on what both positions he's getting paid less than what both positions together would have been. If he had the previous superintendent's salary plus the CEO salary, that would be more than what he's going to be getting now doing the job that we've asked him to do. So for me, that kind of rationalizes why we can do this. As far as cronyism, I would hope to think that that's not what we're doing. And I think there was a day when nothing got done if you didn't have a friend that could help you get it done. But we're past that. The valley's past that. A lot of people are past that. And I'm not seeing it from where I am, and maybe I'm missing it, but I'm not seeing it these days. And a lot of our staff, we have, most of our executive staff doesn't live really in the valley. They live outside the valley. So it's not like there's cronyism from that perspective. Anyhow, we're not going to take the vote right now. We will. Oh, we need to take a vote on this amendment. Okay. So now that we have filled in the blank, the compensation levels will be up from the highest to the lowest, which is we only have two. The first amount that receives the majority will fill the blank. Each commissioner is reminded to vote for or against each and every compensation level unless we know right away that we have a majority. Are there any questions about the process?
Is
Yes,
the motion in order?
Yeah, it will be.
All right, I have a motion when it's in order.
Okay. Yeah, we're taking the vote first
And the vote is on what?
on the salaries that you each selected, which is, and if you want me to repeat it, I will. The filling in the blank for the contract. All right, so we have 196,000
We have 220,000, 220,000, 220,000, and 220,000.
So my question is only, does that now take a motion? And does it mean that if the 220,000 motion goes first, that the second motion won't be heard?
I would say yes. I make a motion at this time to amend the contract agreement to fill in the blank at 220,000. Let's get this going, Gene.
Point
I
of
second.
order, Madam Chair.
Yes.
I said I have a motion when it's appropriate to move, and I'd like to make my motion, and now Mr. Spiker says preempted that by making the motion.
So if I may,
recognized yet.
yeah, if I may, okay? So the method that we set out was to fill the blank. The next step in filling the blank is to take the vote on the numbers proposed, starting with the highest as the least likely to pass. Does the commissioner's proposed motion pertain to this matter?
I thought you said that it was to start with the lowest.
No, you start with the one least likely to pass, which is considered to be the highest when it's a salary.
Well, obviously, the least likely to pass would be the lowest.
It's generally considered when paying someone that the preference is to pay less. We're not speaking here about the specifics that have been offered. It's just a general principle, which is in Robert, that with numbers, if you're offering a salary, you start with the highest. And if it gets a majority, then that fills the blank and we're done with this portion.
Fine.
So you ask everyone in favor of.
All right, everyone in favor of the highest, which was 220,000, say aye.
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 Those opposed?
Opposed?
The ayes have it, and the blank will be filled with 220,000. Thank you, everybody. Okay. Next, now that we filled in the blank, we are ready to consider any other amendments that the commissioners would like to propose to the resolution or the draft employment agreement. Are there any other amendments to the agreement?
I have some amendments, but I'll bow to my fellow commissioners first.
Does anybody else have an amendment?
Does the amendment have to be written in writing?
Well, we'll write it down when you say it, if you want.
A question for the parliamentarian. I see in here typos and comma blunders and that kind of thing. We want to be sure that when we sign this thing, it's correct. Without being petty, how does one make those corrections?
So may I speak to that?
Yes, you may.
The commission can authorize the clerk to correct any scrivener's errors of that type. So you would make a motion that the clerk be authorized to correct any scrivener's errors, and they can be given to her after, so that time does not need to be spent during this meeting.
Good, that's a fair resolution of that.
And there is one typographical error in this anyway that the chair will mention that she'd like to correct.
Oh, okay, why doesn't she go ahead with that? I have some other typos, but I will, and minor corrections, which I'll give to the clerk later.
Okay. We, in the employment agreement, page number 1, 1 to 3rd paragraph down, it says executive shall seek board input and approval if executive desires to create and hire for a separate position as chief executive. That means should be operating officer at any time during the term of this agreement. If there is any objection to that,
No objection.
okay, then we will have that changed to operating officer.
A substantive suggestion.
Yes, Commissioner Paul.
Okay, on page 2, item B, it says by employer for cause, employer may terminate executive's employment for cause. I would suggest at any time during the pendency of this agreement.
Where are you, Commissioner Pollard?
Item 2B, first line, employer may terminate executive's employment for cause at any time during the pendency of this agreement. I just think that helps clarify.
Is there any objection?
Well, you're at
Page 2, by employer.
okay. B.
I have down cause subject to cure under there, underlined, I'm not sure why.
At line, what, in 2B? I tend to, if we need to revamp this, we don't have our
Attorney
legal
General.
counsel here, and I'm not, would be not in favor of doing this at this time unless, I mean, you're asking to change the character
Document.
again of the document, and we did talk about these, and we were hoping that people would have made comments to this prior to, so that legal counsel could actually respond, and what that might mean to the board.
So that would be an objection.
Yeah, and we did have a meeting specifically discussing this.
Is there a second to this objection,
I second.
to the amendment?
Madam Chair, should we discuss then the objection? Is that appropriate?
So the way this works is, the chair says, is there any objection? If everyone is silent, you all agree to the proposed change. If someone makes objection, then it's treated as an amendment. So Commissioner Pollard has moved to amend by adding the words, at any time during the pendency of this agreement, the chair will ask if there's a second. And then it's treated as a normal amendment.
So is there a second to what Commissioner Pollard has suggested? Hearing none, I guess we cannot change that.
Okay, another comment on page 5.
Yes.
Item 10, near the end, it says, district may fulfill its duty of defense by providing competent legal counsel of district's choosing. Now, it is unfortunate that our legal counsel is not here. And actually, I think this meeting should have had legal counsel, so these questions could be answered. I think legal counsel would have agreed with the point I already made. But here, it's a substantive issue. Does that mean that the district will pay for competent legal counsel of district's choosing? It's not clear. It says by providing. So that's, again, a legal question that would be very beneficial if we had a competent legal advisor with us at this meeting.
Can I make a comment?
Yes, you may, Commissioner.
Yes. We had set aside a special meeting for this, and we discussed this laboriously. Our legal counsel was present. Any questions that we had during that time should have been raised, and it should have been submitted in writing if you are opposing to it. And we are now towards this resolution, and we're continually laboriously working to make it harder for the
Okay.
board.
I can make a suggestion. We can call Jay. Jay did notify me, and I believe Ann, that he would be available by phone if we had any questions for him. So we can either take this the way it is, and then can we come back and change it, or can we not legally? If we accept it now, can we?
Could we make it subject to final review of legal counsel or something like that?
Yes.
Okay, well, that's what I'd suggest. We don't need to call him.
But the chair,
Well, then we are left in a limbo.
No,
I
Excuse me.
can't put on my legal cap to give advice to the board.
Yeah, I think that's the.
And I'd like to, but that would not be wise. And I just know that we did have this before us with legal counsel, and at the end of the meeting, we were invited to make written comments to Jay. And he gave this legal agreement, or this agreement to all of us
Yes.
to do so, and to slow a meeting down because you want to change the entire agreement page by page is absurd.
point of order, Madam Chair. I object to that personal attack because at the meeting that we held, the executive session, I did not receive this until I came to the meeting. Mr. Spiker said, and who was in charge apparently of circulating this, said he didn't have my email address. So I went into the meeting cold, and I have tried to contact Mr. Rodney in the meantime. I did not have this prior to the meeting as the other commissioners did.
But you had it,
Have the original.
and there was a
I did not have it.
ample opportunity.
Excuse me.
Point is well taken.
Point is well taken. No. Oh, he can't see absurd. I think, as I recall, we all did have a copy, and as I understand, Commissioner Spikers had let people know that he had sent you a copy once he got a good email address for you.
I had edits only that you didn't see. You had an original copy. The
Okay,
edits
okay.
that I had were sent to
Excuse
the
me,
board.
Commissioner Spikers, you do not have the floor. I'm sorry, but you do not have the floor. What do we do next? Are there any further amendments?
I have a question about item 12, limitations on publicity. I think it's unnecessarily restrictive on the superintendent. That it says that the superintendent will not give interviews about the district, its business or activities without prior permission of the board. I think that's unnecessarily restrictive.
Okay, Commissioner Pollard, I'd like to ask our superintendent, do you have a problem with it?
I'm looking at it once again.
Item 12 on page 5.
I'm reading.
Okay.
The section begins with except for actions in the course of employment. So I'm actually comfortable with this. I think what this is trying to get to is putting a limitation on the superintendent for being involved in those activities apart from the course of his or her employment. And so I'm actually okay with this, provided that in the course of my employment, I can do those things.
Okay, then I withdraw that comment. I think I have.
Thank you for that.
Right. Let's see.
Okay, if there are no other,
I have additional comments, Madam.
does anybody else have a comment?
No, I'd like to make a motion that we close this discussion since we laboriously went over this and have ample opportunity to make a comment and statement either in writing or by email. Thank you.
All right, so that's calling the question. Do we have a second?
Second.
All those in favor say aye.
Aye.
Opposed?
No,
Okay. We're moving on then. I know. Okay, so we are now on resolution 508-616. And that's approving property for by charitable organization. Mr. Parker, will you present this resolution?
I'd be happy to. Would you like me to read the resolution?
If you would, either you or the clerk.
Given the opportunity to read it and the opportunity to spell off Val for having read the last one, I will go ahead and read this one.
Thank you.
Resolution number 506-0616, a resolution of the Board of Commissioners of King County Hospital District Number 4, King County, Washington, approving the, oh God, I'm sorry. See, Val should read this because she'd start with the right resolution. Resolution 508-0616, a resolution of the Commission of the Public Hospital District Number 4, King County, Washington, approving the use of district property by charitable organization. Whereas Public Hospital District Number 4, King County, Washington, the district is a public hospital district and municipal corporation duly organized and existing under the laws of the state of Washington. And whereas the district owns certain real property located in rural King County adjacent to the city of Snoqualmie, parenthetically, the quote, East Campus, unquote, and whereas the Kiwanis Club of Snoqualmie Valley, Kiwanis, have used a portion of the East Campus property, driveway and shoulder, parenthetically, the past 2 years for the sale of fireworks to fund its charitable activities. And whereas the Kiwanis fireworks sale is one of the largest fundraising revenue generators for the Kiwanis, and the club relies on these proceeds to fund local youth scholarships and other charitable activities, and whereas certain concerns have been raised by members of the commission and community members regarding the propriety of allowing the use of district property for the sale of fireworks in light of the dangers of fireworks to children and property, and the opinion that this use is inconsistent with the district's mission of providing health and wellness to the community. And whereas on May 16th, 2016, Interim Superintendent Tom Parker submitted a memorandum to the Facilities Committee setting forth the background of the Kiwanis' use of the East Campus, the public's concerns with fireworks in light of the district's mission to promote the health and well-being of people served by the district, and offering a recommendation to the commission. Attached here too as Exhibit A is a copy of the May 16, 2016 memorandum from Superintendent Parker, and whereas the recommendation from staff is to allow the Kiwanis to use the portion of the East Campus for its 2016 4th of July fireworks sale, but to discontinue such use and access after its current 2016 fireworks sale. Now therefore be it resolved by the Board of Commissioners of Public Hospital District Number 4, King County as follows. Section 1. The Commissioners have reviewed the memorandum set forth as Exhibit A hereto that has been offered by Superintendent Parker regarding the use of the East Campus by the Kiwanis Club of Snoqualmie for its annual 4th of July fireworks sale. Section 2. The Board is of the opinion that it is in the best interests of the district in light of the Kiwanis' charitable nature and the fact that the fireworks sale is one of the Kiwanis' largest fundraising revenue sources to adopt the recommendations as set forth by Superintendent Parker in the fireworks memorandum. Section 3. Accordingly, the Snoqualmie Valley Kiwanis Club is allowed to use the designated portion of the district's East Campus for its 2016 July 4th fireworks sale, but to discontinue such use and access upon the completion of the Kiwanis' current fundraising drive and for all future years going forward.
Is there any discussion?
I probably am very closely connected with the Kiwanis. I've been helping them out on these sales for the last 14 years, I believe, and we've probably given out over 100 scholarships in the community. And yeah, I'm trying to be objective, and I probably could see the point where people don't really feel like that's a really good thing to do to potential dangerous activity to selling fireworks. I do know that the Kiwanis chose not to sell any aerials in compliance with the Snoqualmie City Code, the new code passed this last year, which was, they didn't have to because where the fireworks stand is unincorporated King County. And, but they didn't want to rub anybody wrong with the city. They've been good partners with the city. Cities offered them in the past a spot to stay, and I know the members are very appreciative probably of having this last chance, so they don't, otherwise they'd lose out on sales this year. So I think this is a good compromise. The one thing I think, because I review the scholarship applications every year or every other year or whatever, but surprisingly about 5 to 10% of those applications are for healthcare careers. And I would like to, if we were able to, we made a net profit or we're in the black anyway at the end of the year, any year that we were in the black, I would like to set aside a small scholarship for a healthcare scholarship, only if we were positioned to do so. And that could go right to, we had four applications that I saw this year. 4 of them were for RN, and 2 of them were going to go on to be a doctor. So some really smart people in the applications, good people, and we do need healthcare providers. We're a shortage for the most part. That's something to consider in the future. I think that would go a long way to develop a long-lasting relationship with the Kiwanis.
Thank you, Commissioner Spikers. Any other comments?
I appreciate Mr. Spiker's comments, and we certainly want to support service club activities, and especially those for youth. So I think that the compromise that has been proposed by the interim CEO, still at this point, is a good compromise. I would have preferred that the Kiwanis Club use their alternate facility, which they had already cleared with the city, as I understand it, on King Street in downtown Snoqualmie, because there is no fireworks stand in downtown Snoqualmie, as I recall. And that would position them perhaps for better sales, because there's already a fireworks stand on the ridge in the IGA parking lot by a church that has been there, has predated Kiwanis by many years. So, you know, if Kiwanis felt, based on the resolution and the sentiments expressed, that they want to relocate, they could do that. The permit folks have said they have until the end of June, and the city, I'm sure, would work with them to activate that alternative site they have on King Street across from the railroad there, if they wanted to do it. But otherwise, as I say, I think it's a good compromise. Not my preference, but I think that was probably the consensus of the facilities committee. Although we don't take votes, I believe we reached a consensus that this was a good compromise. Thank you.
Are there any other comments?
Well, I'd like to, trying to build relationships with different service groups is important. And the project that Kiwanis is undertaking, supporting providing healthcare scholarships, is a very novel project. I would like to suggest or make a motion to table this and discuss it further.
We have a
To
motion.
table this resolution number 5080616.
I think what you're,
You have to consider it
After that,
after the 4th of July. So does the commissioner, the motion to table in Robert's rules means to set aside for a short time while another matter is discussed.
Correct. We could always call a work study session for this.
So the parliamentarian will point out that since the effect of this is the 4th of July, and since a work study session has not been set, the motion would be to postpone it to the next meeting, which is July 7th. To postpone it to July 7th,
To postpone it,
that's just
which would be after
the 4th of July.
the 4th of July. So she would suggest that the
I was
commissioner could
suggesting
vote
that we-
against it.
I was suggesting that we set aside a work study to discuss this further.
Okay, so that would be a motion to postpone this to
Yes.
a work study session to be scheduled during June.
Correct.
Okay,
Thank you.
that's the motion. So then ask if there's a second.
Is there a second to that motion?
it would have to be done pretty quick, because they are ordering, they've ordered all of their product, and the stands get set up in two or 3 weeks, so.
I'd like to, I agree part of it regarding the approving the Kiwanis this year. But future, I thought that is one of the things that we need to discuss further.
Okay.
Thank you.
I think,
For clarification.
I think what Commissioner Herron is indicating is that we should maybe talk about this as being some kind of permanent relationship between the Kiwanis and the board, and maybe looking at a potential scholarship for healthcare career. And I think that's.
Yes,
that would-
yes.
And
Thank
so I think that would be probably something we should discuss down the line. And that's a very good suggestion. I would agree with that.
So do we have a motion or do we not have a motion?
I don't think so based on.
Okay.
If the intent has been clarified, and then if.
My motion was clarified by Commissioner Spikers.
Does that mean you've withdrawn the motion?
I
The
believe.
first motion, the second motion was clarified, and I will,
I think that it sounds to me like Commissioner Heron understands that this is already in effect for this year.
correct.
So if we want to do anything different, now whether if we accept this letter as a resolution, then we would not have it next year on the property.
No, that's not my intent. My intent is to continue
The relationship.
the relationship between, yeah, thank you.
And so that's not a problem, because property is different.
Yes, yes, it is. Okay.
Madam Chair. Madam Chair, I thought that what Commissioner Spiker said was maybe more constructive, and that is to have a relationship with Kiwanis about supporting scholarships for people headed toward healthcare careers, notwithstanding the fireworks issue. That's what I understood.
I believe
Is
that's
that correct?
Yeah,
And
I
in
think that's
connection,
what Commissioner Heron wanted to do to continue that relationship.
May I make a
and
suggestion?
let me finish. And what I would suggest Mr. Spikers consider is scholarship is one thing, but we could also look at supporting employees in educational endeavors as perhaps an alternative to scholarships, and it would serve the same purpose, or it could be in addition to scholarships. But I can see what Commissioner Spikers is proposing, and I certainly agree with that.
How about if we put on the agenda for next month that we want to have further discussion on our relationship with Kiwanis and scholarships?
I agree.
Okay, then that would be what we will do then. We will just make sure that it's in.
And for that matter,
Commissioner Herron, do you feel comfortable with
Yes,
that?
I will agree with the condition that we will put, I will agree with this resolution, but with the condition that we will discuss it, the future relationship with Kiwanis on the next meeting.
Commissioner Young, you have something
Well,
to say.
that's pretty much what I was gonna say. We can do whatever we want because there's no date specified that we will never do anything with the Kiwanis. So
No, it does have, it's
I just,
excessive.
yeah, I think that's a good idea because we want to maintain a good relationship with the community, good community service organizations that do a lot of good work in town here, so I would agree with that.
Mr. President, I think if we're going to work with service clubs, which I support as a former Rotarian, we should not limit it to Kiwanis. It could be that we could look at our relationship with service clubs in the valley as to how we might work together for youth activities, educational and related, especially in the area of healthcare.
Is there any other comments to be made about this?
I'm going to make one more comment. We are not discussing what the future is. We are discussing a resolution for right now. Can we go forward with doing that so we can get on with actually voting?
Okay, so now we are moving on, and we will pick this up for a possible, as a subject in the future.
Has a motion been made or?
No,
I hereby make a motion to approve the resolution based on the superintendent's letter. Is that appropriate?
not yet.
Oh, I'm sorry.
We're done. We have got.
No. We're introducing, now we would come to the introduction of the 2016 bylaws revisions. As the chair of the committee, I worked closely with Commissioner Young and Attorney John Rodney, who is not able to be here tonight to prepare these proposed revisions. And as you know, the commissioners also gave comments earlier, both last year and then this year, about the bylaws. Please take them home, review them carefully, and submit any changes or comments to Jay by June 20th, allowing our attorney time to put them in together so that all commissioners may review them. We plan to discuss and vote on these revisions at our next regular meeting. Okay? All right, now is the time to hear from the public. We welcome your comments.
We're not at new business yet. Public comment, please limit your comments to 3 minutes. Whoops, is she right? Benchmarking, okay. Commissioner Spikers, you were going to talk about benchmarking.
Yes, but did we do,
Okay, public comment.
we got one last item, which one do you want to do? Benchmarking?
Yes, benchmarking. We have public comment. I'm sorry.
Okay.
No, that's fine.
Going along the schedule, the benchmarking, anyway, I just want to let folks know, board members, and I know there's one citizen that wants to make a comment about benchmarking, and I think it's going to be a great thing, because we've always relied on what we've done in the past and not necessarily what other organizations and other districts, their accomplishments and their benchmarking process. I don't think that we can be objective without an outside type of benchmarking system. It's going to be very expensive, and there may be some caveats, and that's why I ordered the contract agreement today when I talked to Dana. Steve was good enough to give me your telephone number, and there are some caveats. I want to just make sure that, you know, it doesn't come back to bite us or something, and so I think it would be a good idea for legal counsel to review it. I did want to get this ball rolling and implement it as soon as possible. If there's some other idea that you think is much better, now's the time to create that idea and give it to us in the interim here, because this has got to be done. And there are 3 different systems that we looked at, and we've had limited success with Whipley, I think, and I just didn't feel like we needed to move on to something that was more effective. The QHI is the collaborative, I believe.
Yes.
Collaborative uses it, but it's.
Yeah, the collaborative uses it. I just, those are less expensive measures, but I'm not sure if they get to where we need to be. And a couple of things I thought, the questions I had, can we look back to the first of the year? And with my understanding, I don't want to get into writing, but she said yes. And Dana, that is. And do we have to use this for more than 1 year? This may be great for a long period of time if we do it 1 year. I don't know, but the benchmarking may change 5 years from now or 4 years. It may be only a 1 year thing for a few years. So there's a lot of questions we're going to need to ask when we review the contract. I don't expect anyone to be an attorney, but look at things like out-of-pocket costs, things like that, you know, that we have to look at. And, you know, are we locked into something? Do we have to pay a penalty if we quit? You know, all of those kinds of things that are just, you know, common sense. So I encourage you to look at that contract. And there is really a need to do something, and I think Steve's been asking for help in that area because he just doesn't have that information in front of him.
Does the contract stipulates length of time to fulfill?
I believe so, and so we need to look at that carefully to know what we're getting into. Okay, it's $27,000, but there's some out of pocket potentially and some other, and I just want to make sure we're on the same page and we give the necessary help to our administration because they've asked for this for a while, and I think it'll be helpful for them and the district as a whole, set on certain ground levels.
All right. Okay. All righty, so now it's the time for, is there any other questions or any more discussion about that?
Just, Madam Chair, just to clarify, now, we're just introducing that this time. And the reason we're doing it is so that perhaps next month we can vote on it. Is that
You're talking about from what?
the benchmark?
Benchmark.
Yeah.
I believe so, yes.
Is that correct?
Yes.
Yes.
Okay, thank you.
All righty. Public comment.
Great, thank you. Hi, my name is Carlos Dimas. I'm the president of Palmy Valley Kiwanis. And I did want to thank you this year for allowing us to continue, although I don't know if you voted on the resolution yet, for the use of the hospital property for this year and for the past. As Commissioner Spiker has mentioned, We've been able to provide quite a few scholarships because of this. But also I wanted to mention that part of our mission in having our own stand versus the other stands that are available in the area is we work very closely with one of our Kiwanians who is the chief of, fire chief, to provide a lot of information and a lot of education to the public who are purchasing fireworks at our stand. So we are very aware of the safety issues and I completely understand the potential conflict between the mission of the hospital and the sale of fireworks. However, I would mention that down the street, there is a sale of fireworks happening where a lot of those fireworks would actually be deemed illegal in the state of Washington. And we only sell legal fireworks. In fact, we agreed this year to only provide fireworks that comply with the City of Snoqualmie's ordinance. And we're doing that because we're good citizens. One of the strategic issues why we're located at the hospital is actually we pull a lot of traffic off of I-90 for non-Snoqualmie and non-North Bend residents. So people who are happy to be driving over the pass, or they happen to be driving by through the area, and they see our fireworks signs near the freeway, they pull over and it's very convenient. So that actually increases our sales by a lot compared to the sales down in the King Street station. So that was one of the reasons we did move the stand. So, but I did want to again thank you for past use, and hopefully we get to use it again. Thank you.
Thank you very much. Is there any other public comment?
Mamma mia. I am,
For the record, Jim
Jim
Simon.
Simons.
yes, who am I? Where am I? Jim Simon, Snoqualmie. Thank you. I am very pleased to throw my support to Mr. Parker. He has done things in the last 6 weeks that have not been done under the previous leadership dating back to 2004. And that's pretty damn impressive. I support the salary of $220,000. And you are going to, my prediction is that you're going to get a lot of bang for your buck. Changing topics. Under the prior CEO leadership, benchmarking was not made a priority. Consequently, I wholeheartedly support the Truven Health and Analytics proposal. This is an urgent matter, increasing with each passing day, and requires support of the board to approve this expenditure at your earliest convenience. Ongoing data measurement, assessment, and evaluation of district performance and condition are a vital assessment. Utilizing comparative information will be an invaluable tool for management and the board to improve long-term performance. Thank you.
Thank you. Are there any other public comments?
Charles Peterson, Snoqualmie. It's getting late, we all wanted to go home an hour ago, but
No kidding.
in regard to the Kiwanis, I kind of take exception with something you said. They have a right to get permits where they want to sell, and I understand that the more permits they have areas to sell, the better cut they get on their fireworks. And so whether they sell in 3 spots or 2, that's their decision to make. They just get the permits where they want to get them. Regard to Carol and I attended this meeting for years, and everybody in this room knows why. And trying to get the hospital district to run better, leave the keel, etc. We're very happy that there's an opening here for a new superintendent. But Carol and I have watched, and she couldn't be here tonight. Mr. Parker sat out here and speak when he was called upon. It was always to the point and succinct. I had the privilege of watching him at the last city council meeting. They gave a presentation regarding the hospital district, and I was very pleased.
He is a presenter, and the presentation were excellent. You would have been pleased. And he set the hospital district in good light in front of our city council. And finally, I wish to support his election as superintendent. I think the salary is fair considering he's going to do two jobs now. He was busy before, he just has to work harder, that's all. And so I thank you for the permission the opportunity to speak to you.
Thank you.
Thanks, Charles.
Are there any other public comments?
Would somebody, Madam Chair, point of order,
Yes.
would somebody please keep time and limit
I've
the
been-
speakers to 3 minutes? Thank you.
Okay. My name is Scott Scowcroft, and I live in West Seattle. And as you know, I'm a former staff member, former executive director of the foundation, former patient, a grateful family member, a former patient, and a longtime supporter of the district. I began videotaping these commissioner meetings after a friend of mine reported that she had just attended the most dysfunctional government meeting that she had ever seen in her entire life. Of course, she was referring to the behavior of the then newly elected Commissioner Pollard. I figured that if I videotaped these meetings, perhaps Commissioner Pollard might modify his behavior. Unfortunately, it's my observation and belief that through the years, Commissioner Pollard has only become more skillful, subtle, and nuanced in his disruption. And it very well might be that Commissioner Pollard's behavior is the singular reason why this board has devolved into one that is self-admittedly unproductive and, if not, downright inept. You have all been given a gift. Yes, a new hospital, but also the very same staff and team, sadly with one exception, that transformed a failed hospital into one of the best in the nation. Now, how cool is that?
Excuse me, can I interrupt?
No.
I'm sorry.
Before you embark on planning for the next 15 years, I believe that you must first find some way to overcome Commissioner Pollard's undue, and I would say anti-democratic influence over the work of the board. Maybe all that's necessary is for a little boy holding his mommy's hand to say publicly, the emperor has no clothes.
Madam Chairman, I object to ad hominem attacks.
Who's in the,
Excuse me, Commissioner Pollard, this is a public time. He has the floor and he can say what he wants, and it's our job to sit here and listen.
Will I
I'm
have
sorry.
an opportunity to
May I?
respond?
No, you will.
There is we have a policy. I just wanted to remind everybody. Oh, well, it says if your comment to the board is the nature of a complaint about a district employee or agent, that person will be personally identifiable. Board policy requires that such complaint be submitted in writing to a district official. Oral comments at the meeting will not be allowed.
No, this has happened before. We've had council say that if somebody comes and speaks, that they are allowed to speak.
And we have this in our policy then. Therefore,
I
it should not
think you're right, but I think what council is saying, there's the First Amendment privilege at a public, as long as it does not disrupt the meeting.
Well, I think it's already disrupted.
So, yeah, that's.
Any criticism or
Yes,
anything like
excuse me.
Colleagues, the law is very clear. The policy that Commissioner Herron refers to does not apply to commissioners. It does not apply to commissioners. And commissioners or public elected officials may not censure or criticize citizens who are speaking. And I have spoken, we do not yet have it as a policy, but it is the strong recommendation of your parliamentarian that commissioners not respond to these comments, but simply
Okay, I
allow the
understand.
public to
Thank you,
engage.
but we need to revise this. There's a
That's
lot of
fine.
discrepancies in this
Yes,
statement.
but
Thank you.
that doesn't apply in this instance. I believe me, I've talked with the MRSC,
Yeah.
I've talked with attorneys. and
Because
it's
First Amendment
difficult,
still applies when they have to do the
challenging.
right in writing. It's okay.
It is challenging, but members of the public have the right to say what they please.
Particularly to voted people that have voted in yes.
Yes, I understand, and therefore we need to revise this statement below on the last statement. Paragraph 4.
Probably about a minute, maybe a minute and a half.
given the interruption, I ask that I be allowed to begin from the beginning.
I would prefer not if you could, and I did hear what you said. I don't know if others.
Well, I'll tell you what, Well, I'll just go ahead and back up a little bit.
That would be
because
fine.
The meaning of what I have said is in the context of what has gone before. So if
Yes.
everyone can refresh their memories, I'll just back up a paragraph or two, and I would appreciate an opportunity to be allowed to continue with and finish my comment uninterrupted.
I think that would be just
Could
fine.
could we check the time and see how much time is remaining,
Commissioner
please?
Pollard, we've already taken his time sitting here arguing.
I'm
He has
asking-
the floor.
I'm asking only what time remains.
Go ahead.
Thank you. So, you, Board of Commissioners, have been given a gift. Yes, a new hospital, but also the same staff and team, sadly with one exception, that transformed a failed hospital into one of the best. And now how cool is that? Before you embark on planning for the next 15 years, I believe that you must first find some way to overcome Commissioner Pollard's undue, and I would say anti-democratic influence over the work of the board. Maybe all that's necessary is for a little boy holding his mommy's hand to say publicly, "The emperor has no clothes." Maybe there's no one else in this room except me who is in a position to be able to say that. And if that's the case, so be it. There's an old adage, if you keep on doing the same thing over and over again and expect a different result, well, that's the definition of insanity. So my encouragement to you is to do something different. I'd say be visionary and courageous, and with the right attitude, find a way that the district can thrive in a volatile environment during uncertain times. You already have a staff with a proven track record. Now, all that remains is for you yourselves to become a highly functional board.
Thank you.
Thank you.
Thank you.
Is there any other public comment? Moving on then. We're now to resolution 506-0616, approving the appointment of a permanent CEO superintendent. Is there a second? Second. We'll now take a vote on the motion is to approve resolution number 506-0616, approving appointment of Tom Parker as permanent superintendent CEO. All those in favor, please say aye. Aye. Those opposed, please say no.
Point of order, Madam Chair. Does this include the setting the salary at 220?
Yes, it does. No.
This is just the appointment.
Just the appointment. We're on, included on number 2. Action items, it's right there.
No, it does not. All right. We will now take a vote on motion. The motion is to approve resolution number 506-0616, approving appointment of Tom Parker as permanent superintendent CEO. All those in favor, please say aye.
Aye.
Those that oppose, please say no. And any abstentions? Okay, the ayes have it and the motion passes and that's it. Congratulations, Tom. You are now official.
Thank you very much.
Congratulations.
I appreciate the support like you don't know. Thank you.
Thank you.
Point of order. Now, are we going to vote on the second motion that includes?
Resolution number 507-0616, approving the superintendent CEO employment agreement. Now we take as amended, which it has been. Now, to include the $220,000 salary. Okay,
I make
Is
that
anyone-
motion.
thank you.
I'll second it.
Is there any further discussion? We'll now take the vote. The motion is to approve resolution number 507-0616, approving superintendent CEO employment agreement as amended. All those in favor say aye.
Aye.
Those that are opposed say no. Are there any abstentions?
I abstain.
Thank you. The ayes have it. The motion passes with Commissioner Pollard abstaining. And the employment agreement is approved. All right, now we are on resolution 508-0616, approving use of district property for a charitable organization. We will now take action on resolution number 508-0616, approving the use of district property by a charitable organization. Does anyone care to move to approve this motion?
I make a motion that we approve with the condition that there will be further discussion during a work session, the continuance of community relationship with Kiwanis.
It's out of order.
Is that-
It's on order.
It's on-
It's
oh, I'm
understood.
sorry.
Everyone's
Okay.
agreed. Everyone's
Okay.
agreed to have the further discussion.
We're gonna have that here.
Okay.
The body agreed to have the further discussion, so there's no need to add the clause. So do you wish to move the motion as
I
extended?
wish to move the motion as extended. Thank you.
Thank you. Okay. All those in favor, please say aye.
Aye.
Those who oppose, please say no. Are there any abstentions? Hearing none, the ayes have it, and the motion passes.
Yeah.
I think that's it. Our next scheduled meeting,
Other,
is that other?
other is on the agenda.
Is there anything else?
Madam Chair, I just want to point out that there was no posting for the special meeting of the Finance Committee as required, as I understand it, this time. There has been posting in the past, but I checked all of those days leading up to the meeting, and there was no posting at the Snoqualmie Post Office of the Finance Committee meeting. There was, oddly enough, because it's less required, a posting of this meeting. Well, that's great.
Excuse me, let me ask the clerk. Clerk, has
As
that
far-
been,
And they were posted in both libraries and post offices.
All right, well, we may have a problem that somebody's removing them, but there was nothing there. I didn't check the library, but I will talk with the
I
library.
have an email confirmation on the day, I don't have it with me, but the facilities staff that posted, he always emails me and says that all notices were posted
Okay, well, I checked on
when it's
Friday.
completed.
It should have been posted like Thursday prior to the meeting on Tuesday, and I checked Friday, Saturday, Thursday, Friday, Saturday, Sunday, and Monday, and there was no posting of the Finance Committee meeting.
I
But
don't
can
remember
only
the
give you
date.
that as an anecdote. I don't know.
okay,
The other thing is, with respect to the comment that was made by a member of the public, I'd just like to say that before I got on the board, the meetings of the district lasted 45 minutes and all votes were unanimous. And the district really, well, all we have to do is look at $100 million in debt, and that makes a statement.
thank you. Are we ready to, our next?
Just have a retort to that, because I was on the board and I remember keeping everyone here until 9 or 10 at night. Dr. Whitcoff, I remember the first few years that I was a commissioner, I asked so many questions. So I resent that, and you better make a little better basis for that kind of retort. So please, let's refrain from comments that are untrue.
There being no other
It
business,
is true.
I would like to schedule, we are going to schedule our next meeting will be Thursday, July 7th, 2016 at 6:30 here at the same venue. There being no other business,
Madam
this
Chair,
meeting-
point of order, I believe the board attended, and Mr. Parker, I believe, raised the issue of a work session. Wasn't there a work session to be planned between now and the next meeting?
They're working on it.
pardon me. Superintendent Parker and myself are going to be going this Monday, coming Monday, to Evergreen to see how they run their meeting. Once we do that, we will come back and report to the board and let you know what it looks like, and we'll make plans for such an event for the board to do that.
Can I comment?
Yes, you may.
And I would add that we're going to try to have a work session in June, because I think it would be important to cover two topics this month. One is payment reform and ACOs, and the other is orientation for the board members to the use of the new email domain, just for commissioners.
Thank you.
And you all need to, one thing that I want to say in regards to that is that we also have Chelan, so that may make it difficult to get something scheduled. So everybody's going to have to be flexible for us to accomplish both things.
Thank you.
Okay. Our next scheduled meeting is Thursday, July 7th, 2016, 6:30 here, and there being no further business, I would like to adjourn this meeting.
I move to adjourn.
All those in favor? Aye. We're done. Adjourned.
Well, thank you for engaging us.
Okay.